Assalamu alaikum wa rahmatullah. Peace upon all. Today we will talk about the new development style, and this is the first class we talk about development interactively. So before, in the past, we are just sharing recording, which was in the showing the technique and the examination, and then the next class after that showing how to verbalize and make it appropriate for the new style. But from now, we will get it straightforward from the start. And let's say a few hints first about the new development style. This is the parts of the exam. They are 5 parts. So the first one is clinical, the second is development, third is video station, fourth is history taking, and the fifth is communication. I'm advising everyone not to make common notes. So you need to divide each part of the exam because each part is unique and has its own style and needed information. So you cannot put development with clinical in the same notebook. So it needs to be separate. So this is, if you see percentage by the marks, development represents almost, we can see a great percentage. So here we can say almost, if we take this half and this is 1/3, almost 1/6 of the exam, 1/6 of the total marks. But if we say by the effort and the number of classes and time needed to accomplish it, you will see development needs only four classes, development video needs only 4 classes, while clinical needs too much study, communication as well, history as well. So the philosophy here is to start with the things which you can accomplish easily. So the things which you say, I finished 2 branches, I finished 3 branches, and it represents bulk of the exam. So video and development together represent 24 marks. So it's a big point. And they mentioned that the first step is always the hardest, it's a fact. So this means if you can just have good start and, you know, when I'm saying now, at least I know how to bring 24 marks in the exam. So you start with the most easy branches, and these easy branches push you and provides with a good push forward. So it's a good thing. I hope everybody mute, please. And if anyone is just sharing the video, because here it shows me that there is some videos are open. Okay, so now let's talk about the new style. New style, you will go there either face-to-face or in the laptop online. You will have 5 minutes. So 5 minutes in the start, you are doing nothing. And in this 5 minutes, they are writing here many things which usually nobody read about. So that's why we make it into symbols and pictures so you can see what will happen. In the 5 minutes, either online or in the face-to-face, you will go inside the room, you will find a laptop waiting for you. And the laptop, there's on the screen of the laptop, there are 3 things. So candidate information, a picture. Sometimes in some station, they will provide you a picture like this girl, and the usual picture in the, which showing that the toy is available. So this is the toys available for all the stations, okay? So, and after that, you have the 5 minutes. Usually, one look is enough to say, this is what do you think? Down syndrome, wearing glasses, and she looks fine, she looks well girl. And nobody look at this picture, so everybody knows about the available toys. So it will not consume any even a second from our timing. But here, the candidate information, we need to go through the candidate information and see if we can just read it together, so get the important information, what they want to tell us. This is the development candidate information sheet. So they are describing this is a 23-minute, you will enter the station, you will have 4 minutes, and after that they added another 1 minute. So 4 or 5 minutes to read this sheet. And so you will see usually these are all organizational issue. Again, nobody read this issue because it's supposed to be it's famous and you know it already. So you will not waste your time on reading such instructions. When examiners enters the room, the invigilator will indicate when the station will begin. You may review these rules and choose a time during the station on the screen. So this means I will leave the child, I will leave my precious time, and I come to read this shit. It's not reasonable. So they mentioned your rule. So pediatric trainee at the end of the level 1 training, level 1 training there, the first 3 year. So this is, they called ST1, specialty trainee level number 1. And by the end of this training years, you must have MRCPCH passed already in order to move to the next level of the training. So this means I am ST3. You will talk to Anna, mother of a 3-year-old Lucy, and where is a consultation in a community pediatrics outpatient clinic. And here they provide you with some background information. So Lucy, parents concerned about her development. So it's white term, her development. So they did not specify which part of the development. Please take relevant history. So nowadays, no solution. You must start, we will see now the obligatory sequence, which is 4 minutes of preparation. I will go take history, 2 minutes summarizing the history, and then move to verbalization and description of the developmental assessment. During discussion with the examiner, your approach to the clinical evaluation of her fine motor development will be assessed. They mention you here, so give me a broad complaint, but they tell me that after that, prepare yourself to verbalize the assessment of fine motor development. Okay, so this means, and this is one of the instructions given, if you have to assess fine motor, you cannot ask the mother about anything related to the fine motor in the history. Okay, this is again, take care of this point. So I'm taking history now, don't go to the mother and ask her about, oh, so now could you tell me about, is he reaching for objects? Does he catch object, transfer objects, fix and follow? So this is all are things which is not related, especially if it is milestones, okay? What are the fine toys he's able to play with? So drawing, cutting, cubes, all of this will not be allowed. So ask whatever other 3 aspects of development, but don't ask about milestones of the fine motor because you will assess already, okay? So this is what they mentioned. And then after that, therefore, you should not ask a detailed question about the fine motor skills during the history taking. This is highlighted in yellow now. You will see the instructions. So when examiners enter the room, take a focused history in the first 10 minutes, and they will give you some instructions here. The important to note is if you finish the history before the 10 minutes, so now I took history in 4 minutes, 5 minutes, still have 5 minutes. So I will keep silent or what? No. So I will not keep silent. So I will just say to the examiner, I'm happy now. I have finished already taking the history. Okay, so he will warn me. The role player or the mother will go out of the room and you will not be able to ask her anything again. So are you happy to proceed with verbalization? I say yes. Okay, so this is what will happen in the exam. People are afraid that 10 minutes taking history is not enough. Okay, and I'm reassuring you, most of the candidates nowadays in the new style, they can take history, good neurodevelopmental history in 7 to 8 minutes. And they intend that not to bring too much details, especially if, for example, I can bring you a child with CP, and in order to take ordinary history of a CP, you need can be done in over at least 20 minutes. If it is a typical CP with seizures, many problems, and so it's a challenging, one of the challenging scenarios in the ordinary history taking, okay? But in the development history taking, they are not doing that. So Down syndrome can be associated with 10 to 15 systemic problems, okay? Cardiac history alone can make a big bulk of the issue. But in the developmental assessment, they intend to make the systemic review unremarkable, not to take time of your, so usually if you ask about what about the heart problems, no. So hearing infection now, for example, if it is not related. So if you ask do systemic review for the syndromes, usually they will not provide you with too much information. So usually things in the past history, even no, 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 no. So they are trying to help you to focus on the things which can participate in the developmental delay. So this is important point. Then you will have 13 minutes to discuss with the examiner. So 13 minutes, no, it's not a 30 minutes, it's 3 only. 3 minutes after finishing verbalization, taking history, 2 minutes summarization, and you verbalize. So you will have 3 minutes of discussion, and then the rest of the instruction we will read together. So summary, if I can just minimize this picture. So all what I need is who I am, I know, and I'm talking to mother name, child's name, and then the background information. So this is all what is needed. All others, up, down, everything, or are just, talk, 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 talk. If I am familiar with, I will not read them. So returning back to, now we know about what is the candidate information and what I will be provided with, what are the pictures, and I know now I'm going into the station, how it will look like. So let's see now. Reality, again, in the opening statement, if you go to the official RCPCH site, you will find the opening statement and their syllabus, they giving you example. So they mentioned that we will give you, this is an example of the opening statement. 4-year-old with right hemiplegia, please gather the relevant information of history or history from the parents and then assess her or his fine motor skills. So this means Royal Colleges, they mentioned that we will tell you the patient has right hemiplegia. And if this is not even happening in 1% of the situations or scenarios. So this is now, they are just like, this is the Royal College, and they are playing game with us. So they are trying to deceive us. So this is not reality. This is imagination. This is methods. This is, what happens, this is a problem which you need to find yourself. So we will bring you a child with concern regarding his fine motor, and please examine him. And if you are a good candidate, you will discover the problem, you will get the history, you will put your hand on the important points, and in the assessment, even you have a way to detect that this patient is right hemiplegic. You get the point. So these are things you need to discover yourself. And it's the major soul or the major part of the development station is to find where is the problem. What are the causes of the delay? So if I just came and dedicate it to you or just to give it to you freely like that, so what is your job then? Okay, so this does not happen. This is not valid opening statement. They just bring you a child with delay or child with problem or with concern regarding his development, and please find out the problem. Then they will find that some talk about description, 10 minutes history taking, and then 2 minutes summarize the history. You may be given another 1 or 2 questions regarding the history because they are 2 minutes. So the examiner can ask you some points regarding the history. Then you will get an 8 minute to verbalize and get the dependent cues. So for example, I'm asking the examiner, so if the child able, now I will assess the ability, his ability to use cubes. So I will just to give him an example or show him how to build a tower, and then I will see how many cubes he's able to do so. So, and wait for the reply. He will tell you, no, he's not able to do a tower, for example, or no, he do a tower. But this is he makes a tower and the number of cues 7 or things. So you get the point. So he will give you the child's ability. So you will draw, you will verbalize the exam, and you will wait for the examiner response, and then summarize and interpret the finding. This is all in the 8 minutes. In the 3 minutes, they mention diagnosis, differential, reasoning, treatment plan, and team. 3 minutes usually is short time for the discussion, and things need to be fast. And nowadays, the verbalization of the development does not take time. And the history also does not take time. So usually there are 2 or 3 minutes saved from the history, 2 and 3 minutes saved from the developmental assessment description, and you will find yourself having at least 6 minutes for the discussion with the examiner, which is fair enough to show yourself. So I'm advising everyone, if you are confident and fluent, I'm advising you to go into the discussion early so you can show yourself very well. But if you are not happy with the discussion and you are not well prepared, so you need to consume some time before reaching to the discussion because if you are not ready, giving 6 minutes for discussion is not a good thing. This is the developmental assessment, waiting area 5 minutes, then you will take history in 12 minutes, then developmental verbalization in 8 minutes, and this is 3 minutes for D1 and D2. So D1 domain about the diagnosis and the clinical reasoning, D2 about the management plan and the referral teams. This is the time distribution. And here again, the number of the alarms. So you will be warned about the start. And then at the history taking, you will get an alarm saying 4 minutes left. Then at 10th minute, you will say, stop taking the history and please summarize. Then after that, verbalize the verbalized review videos and the clinical sum up. So here there are no videos provided. So verbalize and get the cues and the clinical sum up and the reasoning and the management plan in the last 3 minutes. So this is a picture worth of 100,000 words. So if you saw just their, you know, this is what people usually get when they see like that, the description of the domain and the description of the station. So nobody, that's why everybody just escape reading such information. But now it's only in, we understand the sequence in a good way. Now let's go by the same sequence of the exam, developmental history. And this is why they changed the topic, because this is the reality. If I have a child coming to my clinic, so before touching him, I need to know what is the problem. So we are taking brief history, and then after that, I say, please sit up on the couch, and I start to examine him. So it's logic, and it's reasonable to start with developmental history taking. The developmental history here divided into, we are dividing any history into 4 parts. So complaints, things related to the child, then family, things related to the family issues, and the last thing is the social. Okay, so you will have multiple, let's say, disputes and controversies about how to make the neurodevelopmental history. Partly because it's a new topic, it's not famous in the books, partly because some of the people just transferring their points of view, okay? But anyone exam-based, he will tell you about the same sequence. So videos shared already by the Royal College, many times, hundreds of webinars, and lots of the exams. So all are describing the same sequence of the what we are doing, okay? So it's all exam-based, examiners' preferences-based, and we have no point of view in the issue. We have hundreds of evidence for the sequence of taking the developmental history. Here, starting by the complaint. What is the complaint? Usually, we are dividing it into the three parts. Complaint analysis, and then what happens before, near and far, and then what happens after treatment and response to that. So this is, you know, the logic thing. And we have a rule in the analysis and taking history, let the mother talk and don't interrupt her. So invite her to talk about her problems and don't interrupt her. And then after that, fill the spaces, okay? So now I have an example of a mother just telling me about the complaint, okay? So doctor, I have a concern with my child's vision and fine motor development. This complaint started almost 3 months ago, okay? So the poor candidate or the robot candidate, he will just say, okay, when did you first notice that? So what? She just told you that I start to notice that 3 months ago. So repeating, asking about things which the mothers already told you proves that you are robot. So proves that you are just a machine. You don't have the sense of what to say, or you are not listening. Okay, so that's why I cannot repeat asking about things which already the mother told me about. So I need only to fill the spaces, ask about the things which she did not tell me about. Okay, so if she just said, doctor, I have a concern regarding my child fine motor development, for example. So, and then, okay, so could you tell me when this problem happens, or when you start to notice this issue? And we have think history, and the history, if you just go to the word meaning, history about timing of the events. So history, I'm having here blackboard. History means, if we talk about history in 1991, something happened, and so we are talking about dates, timings. So that's why they mentioned the most important single questions in history is when. So I need to know exactly when the problem or when this issue become a problem. So mother tell me about just a complaint or something happened. So this, you start to notice this, let's say 1 year ago. So now I know the start point, okay? So if I know the start point, I can just go very briefly here, ask about what happened. Okay, what happened? What happened? I need to, they mentioned that it's a part of my story to get the clue and get the reason. Okay, so if I'm going there and I will never settle unless I get the story, full story. Okay, now if I'm just, I will tell you about one thing which is very important, which I'm telling you a story about a man and a beautiful lady. Okay, so I will tell you the story about them. Okay, let's start. He brought her a ring and they got married. So is that a story? So what happened when they first met? How they did, they love each other, and what are the problems? What are the obstacles? So you get the point? So it cannot be like that. We need to go step back and get the story from the start. So I cannot just catch the end of the story and say this is a story. No. So I need to know now it become a problem. Why this become a problem? Why? What happened? So exactly before this 1 year, he was completely fine. So this is another question. He was completely fine. Yes, doctor, before this 1 year, he is completely fine. This means there is something happened at this point which led to the problem. So I need to know the issue. So at this timing, does he exposed to anything, like does he have any major illness, admitted to the hospital? Does he develop the fever, for example? So is he exposed to any accident or trauma or major event? What happened? So this is if the mother told me, yes, doctor, he had a fever and he admitted to the hospital. So don't stop. So you put your hand in something, you need to get the major issue, and it's a pass-fail criteria. And it was an exam scenario before, okay? So what happened? He has fever and admitted to the hospital. Okay, could you tell me a bit about it? Where exactly in the hospital, what they told you, what investigation they did? And the mother will tell you he's admitted in the ICU, he's having very high fever, he developed rash, and they take a sample from the back. And then I start to notice that this child has meningitis, for example. And one of the pass-fail criteria in this area is to know the nature of the rash. Okay, so could you describe for me the rash, please? So, yes, doctor. So it was red spots and some of them contain water-like fluid. So did I get what is that? What could be the reason? So this is herpes. So this is chickenpox. So now, yes, it's mostly chickenpox. It's mostly chickenpox meningitis. I get the point. I get the point and I get the reason. Yes, and I get the full story now. child at the age of 3 years, he has fever, and after that, major issue, meningitis, and after that, he has developmental regression. Okay, so, and I need to ask the mother. So now I get the story from the start point, and after that, is he losing skills or just arrested the point? So just to stop the skills, he's not gaining any more other skills. So he's losing skills. So he was able to run, he was able to write tricycle, but now no. So this means developmental regression. Okay, and what did you do for that? What did you do for that? So we go to the GP and he refers us to here, for example. So I know now, or we are following with the physiotherapy, we are seeing neurologists, and so I need to know what happened, what is before and what is after. Okay, so I am going to take history with a clear focus. I'm searching for the full story. What are the causes of the delay? Okay, so this is a clear example, but what if the mother is just telling me this child is just, he has a concern regarding his fine motor or his gross motor problem, for example, and when did you notice that? So she give you a vague issue. So no clear point. So at the age of 3, so doctor, he's always late, and he walked at the age of, let's say, 20 months. And so long story, and I cannot see an exact start point. So at this situation, you need to take the story from zero point or 0 minute. Okay, so you cannot put your hand exactly on the start point. You need to get the story from the start. So now let's talk the story from the start when you were first pregnant with him. Was there any problem? And you start to take from the antenatal problem. So quite clear. So I will not leave you unless I get the full story regarding the issue. Once I finished, put my hand on the cause of the delay, and I get the story from the start and the end. So I have here 2 situations, because some people keep asking me. So antenatal history, antenatal or neonatal perinatal history, can I put it in the past and medical and surgical history? Yes, you can. If I have a child, I told you, I have a child who is completely fine over 3 years, and suddenly he developed lately a problem, and this problem is the major cause for his delay. So anything happened before this point, I can consider it like past medical and surgical history because they are not related. It's not part of the story. Okay. So now this is the situations we get. What if they are showing me a picture of a child with Down syndrome? Okay. So what should I do? This is another thing. So shall I keep it secret, or I'm afraid to tell the mother about it, or the mother, do you think that 4 years with features of Down syndrome is a secret? So nobody will discover it through all out the station. So you need to go directly while you're talking to the mother, introducing yourself. Okay, so I got that you have a concern regarding the child fine motor. And what I noticed that your child has features of Down syndrome. So tell her directly. Okay, tell her directly about the issue. So could you tell me a bit about your concern? From the 0 moment, I got it early, and tell her early that I got your child that has features of Down syndrome. Tell me the story. Okay, so nothing to hide, and you must be clear to the point. Now I have clear part of the attack or clean plan for the attack. Complaint, I heard from the mother, and then completed the history, when exactly this happened and what happened around this time for this issue to occur. If I cannot put my hand in the start point exactly, okay, so I can complete taking the story. So do you think he's losing skills, or he's just gaining skills in a slow way? Is it progressive or regressive or delay? Then what happened after that? What did you do for this issue? And then let's take the story from the start, searching for the appropriate reason. So it's part of I need to know what happened. So when the problem exactly started. Okay, this is done. This is stage number one. I got the story. Okay, then moving into the stage number two, which is child developmental history. And here the controversies, people keeping this part into the final part. So they are too classic, too old. So I can see dust covering them. So, you know, exactly what happened when you come to my clinic or I come to your clinic talking about, doctor, I'm having severe headache. Okay. And I have, for example, hypertension, diabetes, and whatever. And you start to taking classic history. Okay, when you first having diabetes, when you first having asthma, and what about the blood pressure, which team you are following with, and you keep until they come to the point in the systematic review asking me about my headache. So is it reasonable? No. So if it is a major part of concern, you need to take it first. Okay, so I cannot, if I have a child coming with GI symptoms, vomiting, diarrhea, or anything, I'll say, no. GI must be taken in the middle. I need to take it from head to toe. So that's why the good doctor in history taking is piano. You know, piano player, he is selective, very selective. He know which one to press first and which one to keep it until the end. So now it's in the spotlight. So child development, it's called neurodevelopmental history, how to keep it to the end. Anything can be staying in the end. Mother now is coming to me with a concern regarding the child development. So I need to cover the development first. So now let's go after finishing into what is the problem regarding other aspects of development. Okay, so this is the child developmental history. I'm sorry about the title. It's not fitting with the so okay. So anyway, I will amend later on. So because I just, you know, I take the presentation upside down and I did too much amendment in the last 3 hours. So here we talk about, now I finished, I talk about the child, I get the prenatal history, talk about what happened prenatal, natal, postnatal. And then after that, I will finish, I will move into the development 4 aspects, gross motor, fine motor, vision, hearing, speech and language, and social. We will do that. And after that, we will go into the post-medical and surgical history, which is things related to the hospital. Okay, so let's say in the prenatal history, if I have to take the prenatal history now, so must I have 3 screening questions? Prenatal history, if I showed you, can contain up to 20 questions. Okay, can contain up to 20 questions, but it's not applicable and it's not logic. Okay, so that's why you must have always screening questions. Screening questions mean I will ask you general, broad questions. And if I put my hand on the problem, I need to stop and go in depth. Okay, so the prenatal history, I need to talk about pregnancy. So pregnancy was okay, means gel scan, no infection, no treatment, no drugs, no alcohol use. So pregnancy was okay. This is the screening question. Okay, and if I have a doubt about prenatal history, I can just, so this means gel scans was okay, no infections. So you're not using any drugs or alcohol or any medicine. So I can go a bit in depth and ask about the others. But if I think I put my hand already in the problem, and this is now, it's just only for completion. So I give you an example. The history we talk about, which about the meningitis at the age of 2 years, for example. Child was completely fine after that. So no need to tell about this issue. No need to tell about the details. Just I put my hand, the child was okay. And this is all non-relevant. So it's famous. Let's just go there and say pregnancy was fine. Okay. What about delivery? Because I know they are not the major issue here. So this is a smart how to eliminate parts of the history. Delivery was fine. Okay. Does this mean he was born normal time? And what happens after? Post, did he have to stay in a special care baby unit for any reason? Okay, so quite clear. 3 questions, only screening. If I put my hand, mother say, yes, he stayed in the special care baby unit for almost 3 weeks. So poor candidate move and say, and move to the next step, but the good candidate, 3 weeks, why? You need to tell me. So you will discover that there are major things which happen during this time which may affect the development. So a child asphyxia, stormy neonatal period, breathing machine, so intraventricular hemorrhage, any major things which can affect the development. So that's why it's called screening. Any positive response to any questions of the screening, you need to take it in details. Not too much details, but at least you get the story. So because some people misunderstand me and he started to take detailed, comprehensive history. No, just to get the story, what happened? Okay. Now, moving into the development 4 aspects, vision and fine motor. So we are covering here the things in the first year of life. This could be life-saving. Usually you will not need it. Usually you will not need it. In very few circumstances, you might need it, but at least no summary of what are the developmental milestones in the first year of life. Okay, here, vision and fine motor. At 3 weeks, he must fix and follow. So 6 all about objects. So they are all the development here about objects. So he see objects, he reach for objects, he catch the objects, and the catch have 3 things, how he catch it. Is it palmar, is it pincer, is it lower pincer or higher pincer or refined pincer grab, or is it the objects he throw it and the banging and the banging together, so hitting the things together. So this is now vision and fine motor all about small objects. So again, vision and fine motor about fix and follow, small objects. So he see it, search for it and reach for it, transfer it from hand to hand, and the way he catch it, and then is he using it appropriately or is still in the area of banging and casting? This is normal developmental milestone till the age of 18 months. So LA means limit age. And the limit age mean if this does not happen or does not disappear by this age, this means there is something abnormal. So you will see child 3 years, he's still having banging and casting. So he may be syndromic, he may be something in social autism or things like that. So this is very important. Limit age, 18 months. So here, fix and follow, supposed to be at the age of 3 weeks, and the limit age is 6 weeks. This means if I don't have fix and follow by the age of 6, this warrants referral. Okay. Pincer grip, and we will see the grips later on about the types of grip. And this is the first year of life, which usually we will not need it. So take care of the mics, please. I have opened mics. Dr. Rashmi, please. Dr. Maha. Okay, so now let's move. What are the questions? I must have 2 screening questions to cover the issue very fast way. This is the question we got it down here. So what are the fine toys he's playing with nowadays? Fine toys, small toys he's playing with nowadays. So the mother is instructed and the role player, they mention you don't have to take detailed history regarding each part of the development. You can hit it only. So hit it means 1 or 2 questions to hit the issue. Okay, so this is now, you can see that there is if you know Dr. Aniel Gregg, he's examiner, he has a video talking about this point of the development. It's in his official site. So you can see he's talking about this issue. So you can just only touch. And there are 3 official webinars in the website. They are all saying this issue. So you don't just, now I have fine motor and vision, they are 6 toys. Should I ask about the 6 toys? No, no, just make sure that he's appropriate for age. So now the role player is telling me that he's playing with, he can draw, he's playing with scissor, he's playing with cubes. But what if, I'm sorry, what if she does not get me? So I say, okay, is he able to draw? So now she must tell, it's not a big issue and I need to tell her, what about the pen, how he's catching the pen? So this is not suitable for the mother. This is not suitable question for the mother. This is technical issue you have to observe. But the mother can say, yes, he is draw a man. He drew daddy 3 parts, for example, and if I just make a circle, he can copy it. So she can describe you what he's able to do. So is he able to draw, cut with a scissor, build a tower, how many cubes? This is more than enough. So ask her first what he's able to do in terms of his using fine toys. And if she can get the question, go make it simple for her. Is he able to draw, cut with a scissor, build with a tower? Okay. Then moving into the gross motor skills. This is the summary of the milestones that he can do at the age of 1 year. It came in the exam, especially the UK online exam, only in the current, in the UK exam. So assess gross motor skills in infant younger than 1 year. So that's why if I don't know at least the titles, so we will do it, we will do this scenario together, but at least to know the titles, the big issue, it can save your neck in some situations. Okay, so ball to set. So here 6 weeks, and here I put 3 months. Everybody know ball to set and the head lag and the things like that, but the limit age is 3 months. Prone to supine at the age of 4, and the reverse supine to prone at the age of 6. So then set 6 to 8, you know, 6 will be arched back and 8 will be straight back. Okay, pivots and creep, stands at the age of 10, walks at the age of 12, and the limit age is 18. Okay, functions of the hands and the legs. So this is now the major milestones that I need to go through, and we just make it into PES. So PS. So this is to make it easy for you. Screening question, usually for the exam, most of the children in the exam, let's say 98% of the cases are at the age of 2 to 3 years. 3 years, 3.5, 4 years. So they are between 2 and 4. And they mention in the Royal College, they never will be older than 5. So in the past, before the new style, they were bringing child 7-year-old, 6-year-old. But nowadays they mention in the official site, they will never be older than 5. So usually the age between 2 and 4. Okay. So I am asking appropriate question. For example, what kind of activity he's able to do? Activity, major activity. So is he able to walk, run, jump, hop? We will see this all in the table, but it's a good thing to just to follow his ability, walk, run, jump, hop. And the last thing, I can just add one thing, what about going up and down the stairs? So this is 2 screening questions. I think they are easy now. 2 screening fine motor, 2 screening gross motor. In the receptive milestones, you just take this copy and just take it capture. This is about the milestones at the first year, which usually we will not using it. 6 weeks started to loud sound, 3 months still to the mother sound, 6 months understands bye and no, and 7 months turns it to the noise, which is the basis of the distraction test, and the 9 month enjoy rhymes and response to own name. You know, for myself, I know this is not important, but I never go the exam without it. So I don't know, at any moment I may need it, and that's why we are not making adventures. Development is 12 precious mark, supposed to be all in pocket. So 12 marks in pocket, this is supposed to be. So that's why no place for adventure. It will not cost me anything to just know them by a simple way. Okay. So now, what is the screening question? Is he able to understand? So I will just ask the mother about the receptive. Is he able to understand you? Take care of this point. Receptive mean I'm talking to him. So now if I say, show me the lion, is he able to understand you? Yes, he's able and he's following my orders. And where's daddy? He show me daddy. So let's observe the word we are using to describe the receptive language. So if he's able to understand me, this means he's able to hear me. Okay, and is he able to point to the body parts? So this is only two questions to screen for the receptive. And then after that, moving into the expressive making bubbles, mono and poly, and words, usually 3 words at the age of 1 year, 6 words by the age of 1.5 years, and you need to know the number of words. We will talk about it in details. What are the number of words? So number of words he's able to use or he's using, and then are he able to put words together? So that is car or show me that. So 2 words or 3 words. So now the 2 C's and 3 S's about color, count, song, and story. So I can ask them those as screening for expressive language. The last thing, which is social. So 6 weeks social smile, 6 months mouthing of objects, 2 things by the mouth, 9 months peekaboo and stranger anxiety, higher mental functions, and the 12 month bye-bye and hand clapping, 2 by the hands. Okay, so this is the social milestones in the first year of life. Again, just keep them in pocket in case you might need them. How I am asking in the history about the social milestones, only 2 screening questions. So play with kids, play with himself. So this is play, feed himself, and toilet training. So these are the questions of social history. So we are talking about screening. Again, take care of the point. I'm talking about screening. What if I have the issue that this child could be autism? I will just keep for this simple 3 questions. No, I will turn it upside down and I will go take detailed history covering the social autism. But if social, show me, for example, child is joining our kids, other kids, and he has sharing toys with them, and he's using simple play, pretend play. For example, he's able to feed himself with a spoon or fork. Okay, so this means I have a child, yes, he could be having some delay, but he's not autistic. Am I right? So no need to go further. Okay, because I'm doing, even if the social is showing that the child is having delay, but it's not a major issue, it's not a big issue. So I just need to know my main point of view, why I'm doing like that. So I have a child presenting to me, the opening statement says, problem with fine motor. And I get the cause of that because of meningitis. And then I move to assess other parts of the development in order to say, is it global developmental delay affecting all parts of development, or no, it's a problem isolated affecting only fine motor? So this is the philosophy simply. So that's why if I have a child who's, yes, showing some delay in the other parts, but it's not autistic, for example, it's not a big issue. So, okay, stop and just to make it simple as it is, screening. I put my hand that this child has global developmental delay. Okay. Now, things related to the hospital, we are talking about chronic illness, major illness, operations, accidents, admissions, trauma, team, medications, and shots and jabs. Also you need to ask about. There was controversy about, do we have to ask about immunization or no? And the last release, you have to ask about the shots and jabs. You know why? Because it could be indicator of negligence. So if I have a mother which is showing neglect, and she's not caring with the child, she's not giving him the vaccination in the appropriate time, so this can share to the point. So asking about allergy, again, was controversial, but you can ask about allergy. So allergy and shots, you can ask them about. So that's why usually we are doing them into the CAT 3D. So CAT 3D make things easy. So the CAT 3Ds. So CAT about chronic or major illness. So I have a child, Down syndrome. Is he having any chronic or major illness? Okay, is he having any operations? Then after that, we are talking about allergy. And the T for time development. So teen, usually I'm talking about neonatal period. So we can say it now, just to replace it to be, because I have a child will never be younger than, so growth and development. So this is now will be just neonatal period, neonatal and growth. Okay, this is CAT, we have a different design for the major history, but this is now, we just need to ask about neonatal and development. He will never be puberta, for example. So neonatal history, if I did not make it, this would be appropriate place to ask about. Then the 3Ds, we are talking about doctors. Is he following with any other doctor? So neurology, physiotherapy, so who's seeing the child else? So then after that, we are talking about after doctors, departments. We're talking about admissions, we're talking about operations, accidents, ER visit. So departments of the hospital. So A&E about accidents and trauma. So ward about admission, OR about operation, having major operations. So this is mandatory? No. You can skip some of them? Yes. So if you put your hand on the cause of the delay and you are happy with, so you can skip that. But if you are still wondering, what could be the cause of the delay and I'm not yet happy with the cause of the delay, I have to ask about. So, you know, I have a history encountered in the exam, child with congenital heart disease who had heart surgery at the age of 3 years. After that, he had a major event with stroke and hemiplegia following the cardiac surgery. And the cardiac bypass is the known risk factor of having thromboembolic events. So this means if I'm not happy about what happened and I put my hand in the issue and I'm asked about, so I can ask about it, yes. But if I'm happy with I know this is child post-meningitis, no need to ask about operation. No need to ask about things which is could be non-relevant. You can skip it, yes, I can skip it. So doctors, departments, drugs and shots. Drugs, is he using any drugs? Is he shots giving drugs and shots? This is the last D. So now we are talking about the hospital related, or this is past medical and surgical history, and all of them, you suspect the answer for the majority is no. And supposed to be, this is, we call it on the run. Does not take more than 40 to 50 seconds. So that the child has any major chronic illness, no operations, accidents, trauma, no allergy, no. What about his, when he was first delivered, was there any pregnancy problem? No. What about delivery? Does he have to stay in the hospital for any other reasons? No, no. Trauma, accidents? No. Is he seeing other doctors? No. And what about the medication, only vitamins? So you will discover that the post-medical and surgical history in the majority, that's why it's not detailed. They are not providing you with too much detail, so you will discover that this part is done very fast. It does not take time. Family history, we are summarizing all the history into 2 questions only. Pedigree and illnesses. So take care of this point. All the family history is only 2 words, pedigree and illnesses. In the paper, I took it already, and we will see that when we start to practice taking the history, we will just make, this is the mother, this is the father. And I have a boy, Okay, so this is a boy that I got. And I'm asking the mother, so you and the father are married, blood related. So yes, so I will, if they are blood related, I will put 2 lines. So are you living with the father? So this is ready made for me. Are you blood related? I will add another line. So again, this is pre-made, and I have my child is a boy. This is pre-made. Now tell me about your family. Are you and his father are blood related? The mother say yes. Do you have any other kids? Yes, we have other 3 kids. So this means Omar is the youngest? Yes. Okay, so they have boys and girls. So yes, 1 boy, 3 girls, for example, or 3 other girls. Are they okay? Are you okay? Any disease that run in the family? So I need to know, and if I have anything which is a similar condition, I am drawing like that, so I can know now the pedigree. So this is in terms of the family history. In terms of the social history, I need to know your understanding of what is meant by the society. I'll just turn on the AC. Okay, so this is again, we will see here, this is, we are taking the child at the center of the care, and the child is surrounded with the family, and the family is surrounded with the society. So society is all things are in contact and touching and interacting with the family. So the society could include, number 1, social services. So social services, what is here the social service can help with? So they providing what we call disability living allowance. So money given to families with the kids and the children with special or chronic disabilities in order to help them, or if they are having income problem or some sort of financial issue, they are not working, COVID at home. So I need to know that if they're having any income problem, or this can affect the child care. So this is the social service. And then after that, moving into CAMS. CAMS stands for the word Child and Adolescent Mental Health Services. So we are talking about the psychological aspect, emotion. So money and emotions. Emotion, I need to ask about the child. So child, if the child has any problems. So is he seeing anyone from the psychological point of view? So CBT stands for what? So cognitive behavioral therapist, or educational psychologist, or psychiatrist, or support groups. So these are the things which can help the child. I'm trying, why I'm asking social history. Is it important? Yes, definitely it is. And it will put your hand in the areas you can help the child with. So I have a child and the society is not helping him, and they not provide him with any help or support. So this means I can make it as a problem list, and I can direct the family to make the best benefit of the available resources. Okay, so now I will say we will take in details about the function of everyone in the team. What is the CPT? What is educational psychologist? What is the psychiatrist? What are the support groups? So let's talk about them here one by one. So cognitive behavioral therapy, cognitive behavioral therapy. So from the name, cognition and behavioral. So they are carrying with the problems in the cognition, and we add them emotions and behavior, CBT. So usually they are found hospital-based, and they can be found as a specialty. So certain specialty to be referring the child to. They are dealing if any child has problem with behavior, so he's aggressive. Okay, so for sure this will affect his cognition and his emotion. And if he has problem in the emotion, For example, he's depressed. Okay, so he will assess other aspects of the cognition and behavior. So they are triad. CBT is dealing with problems in the triad. If I have a problem in the cognition, you come to me in the morning and say good morning, and say, why he's shouting? This means I have problem in cognition of others' reactions and others' words. And this cognition will for sure affect my emotion. I will hate you, I will not like you, and I will deal with you differently because I have problem in the cognition. You just mentioned good morning, but I take it wrongly. Okay, so that's why CBT is dealing with problem in the triad of emotions, cognition, and the behavior. So doing analysis and guiding the child toward correction of this issue. So it's a type of talk therapy. So this is the cognitive behavioral therapy. Educational psychologists, from the word, they are concerned only with problems in the education. Educational psychologist. Psychiatrists, what is the difference between psychologist and psychiatrist? Again, psychologist is a kind of talk therapy. Usually he's not a doctor, not usually, almost always he's not a doctor. So he's just making a postgraduate degree in the psychology. So may have a literature or and reading post, but after that he prepares and make after that he become a psychologist. But psychiatrist is a doctor, okay, and he can write medicines. So psychiatrists usually needed for children who needs medicines like problem in aggression, so tantrums, so self-injury, or aggression means he can injure or harm the others, and we will see that in details later on. Support group, you don't know the benefit of the support group unless you go there in the YouTube and search about the support group and what they provide. People telling about their story in the support group, mother having a child of Down syndrome. She was thinking to suicide. She was thinking to just throw the child away and run. And she was so sad and depressed. Once she joined a support group and saw families with the same problem and how they are keen to help the child, and they are very happy to lead the child to have a normal life. So this turned their point of view 180 degrees, and they become very good and cooperative. So if you see the problems of the other, you know that your problem is small and you can deal with that. So that's why support group is very important, and it's a major thing to consider. So if I ask the mother, are you following any support group for Down syndrome, for example? No. So this means I can put it as one of the things I can offer to the family. So I can put it as a problem list. So mother is depressed and she has a psychological issue and she's not following with any psychologist or not seeing any support groups. So this means it will be part of my problem list. Then moving into the third part, which is the education. So education, we are talking about special education or mainstream. So special equipments used, play specialist. So mainstream school, I need to know what is portage. So portage, this is, school visiting. So this is teachers visiting and or type of training and education offered at the home. So we will see this in details. We will talk about it later, but just a hint about it. I have a child with CP and quadriplegic sitting at home. So one of the teachers is just to visit the family and teach the mother a skill. And he allowed the mother time to train the child this week on this skill. So how to talk, how to communicate. And the next week he will come teach the mother another skill. So this is called portage. So, okay. So all of this, then moving into the third thing, which is NHS, health visitor or card service, respite care. So this is all health services provided by the NHS. In brief, we will know details about them. You know why? Because you will be asked about if you say, and sure you will be asked this question, what is the team you want for this child? Or what the referrals you will do for this child? And you mentioned in terms of his financial problem, I need to involve the social worker. So he will say, what is the social worker will able to help with, for example. So he will ask you, what is the job description of the social worker? So in terms of his health problem, I can say health visitor. So what is the job of health visitor? So you will be asked in the discussion these questions in detail, and we will tell you all about them in details. So this is what is meant by the society. Hide. Okay, so now I'm trying to find out if the society around the child is helping and supporting, or no, they are hostile and the child is neglected. This is very important. I have a child and he's in a very poor country, and I'm asking the mother, are you having financial problem? Yes. Are you taking any financial support or income support? No. So are you seeing any psychologist? She smiles. And then what about education? She say, we hardly eating, no education. So anyone is visiting you at home regarding following up the child condition? No. So this means the society is hostile. They are very bad. But or maybe the society is good, but they don't know about the child. So I need to refer the mother and guide her how to make benefit of the available services. You get the point? So it's a major part. And now just in one slide, you get the meaning of all what is important. I get that. There are 4 major areas: money, emotion, education, health. This is the major 4 cornerstones regarding the child. I need to cover them, and I need to make sure that the child, is he taking the available services or no? If no, so I will include them in my team. Okay, so this is clear to the point, and now one slide makes it very easy. I hate the list studying approach. So this is the worst. It never scratch in the mind. But here I even know where is the social, where is the camps, where is the education, where is the NHS, and I can ask them one by one. Recall and the presentation. How to present your case after taking the history. So we are following the SPAR approach, and SPAR is a universal language, and I intended to bring you a PowerPoint slide from the NHS about using the SPAR in talking and presenting your cases. So S for the situation. So situation means what is happening now. What is the complaint? What is the complaint the mother is presented with? Background, they mention things in the past which is relevant. So things in the past. So I have a child, mother complained of developmental delay. This is in the background of being Down syndrome. Okay, so this is all in the background. Assessment means things I see it in my view. So problems or issues, I get it. So now I'm taking it in a very systematic review. So mother had a complaint of whatever. This is in the background of referring to the cause of the problem. And in my assessment, I found 1, 2, 3, 4. And recommendation, I need the things I offer to help with, but here because we still not making full assessment yet, so I'm not saying a problem list, but I say what I need to do next. This is an example. Lucy is a 4-year-old girl whose mother had a question regarding her fine motor skills started 1 year ago. So this is in the background of being Down syndrome, diagnosed antenatally, which is associated with neonatal history of feeding difficulty, but no other health problems. In terms of her development, so I noted that Lucy has a global developmental delay affecting all aspects of development. So the past history is unremarkable except for hypothyroidism being treated with L-thyroxine. Regarding her family history, so there are no family history of note. See now, one thing, if you are smart enough, you will find that I am dividing my talk and I'm giving title of what I'm saying. So we have a way, the way mentioned that you need to make it in paragraphs and to have brief pause between the paragraphs. So the examiner can understand where are you. So Lucy, the 4-year girl old whose mother had a concern regarding her fine motor skills. This is problem started 1 year ago. Then this is in the background of, and I am saying it as a paragraph, and I never stop before completing my paragraph. I give him a title in terms of the development. I noticed past history is unremarkable except for no family history of note. Social history showed that the mother has psychological issue. Child is not seeing any support groups. Child has educational problems. So I'm saying what are the problems. Then after that, I like to revise the child's medical record and her red book. Hi. So 1 minute. No. So sorry for the interruption. Then I'd like to revise the child's medical record and her red book. Supposed to be the recommendation mean I'd like to refer her to, I'd like to make an appointment with, this is my recommendation or advice to admit her, for example. So, but here, because we are confined to a summarization of the history and we are not yet in the area of the discussion. So this is not the appropriate time for the plan or for the team. So I'm talking about what I recommend to do regarding the points of the history. This is the best way to present your case, brief, informative, organized, and the message is clear and can be received clearly by the recipient, by the examiner. Okay, so it's a presentation of the case is a skill which can be acquired. So anything by training, you are organizing your mind. You are organizing your mind. And it's really very important. I talked about it in one of the general's presentation. They mentioned like, you know, my closet, if I have my closet and my closet is upside down, so underwear, everything's just upside down, and the socks, I don't know, they are all like a mess. So if the area is dark and I need to just take one piece of thing, like pair of socks, for example. So I cannot, because everything is upside down, okay? But just imagine this closet, so is organized, so and categorized. So socks in a base, trousers in area, and shirts in area. Even if the room is dark, I can just very simply just take what I need in a piece of seconds. So they mentioned your brain is the same way. So if you are processing and handling the information and organizing your mind, the recall will be extremely easy. So you know where the piece of information is, and when you need it, you will just get it very easily. They are the same. So you need to organize your mind, and this can be get by training. Say, I will first talk about the mother's complaint and the story of the illness. Okay. Then after that, I will talk about developmental problems. Then I will talk about the post-medical and surgical, the same sequence of the history taking. Then after that would be easy, family, social psychological problems, and I'd like to revise the child's medical record and her rate book. I think now don't categorizing the task even will be easy for you to recall and easy for the examiner to follow. This should be done in 30 to 40, let's say 1 minute, up to 1 minute, because development now you have 2 minutes. So up to 1 minute I present, as long as I am talking organized way. So, okay, and you need to get trained. Believe me, the first trials are always lagging, staggering, forgetting, missing. So this is the usual, this is the normal. But with training, the more you get trained and the more you're repeating, the more recording and the more you're listening to yourself, it makes wonders. So developmental assessment. Now we finished the history. Before moving into the second part of the exam about developmental assessment and verbalization, anything is not clear regarding history and the presentation of the history. So you will never be able to you will get more insight about the history once we start to apply. So we have almost 12 to 15 kinds of scenario covering all aspects of neurodevelopmental. They are all exam-based. So the more you will get in the area and the more you will get involved. So we will tell you about all neurodevelopmental histories encountered in the exam. So just rest reassured, this is definitely I'm telling you, if you just a little piece of effort, development is supposed to be 12 marks. You get 12 marks, but you need good training, good practice. Okay, now I'm asking about if anyone has any questions before we move to the second part of our class for today. Anyone has any questions, or I can move?
You can move, Dr. Yusuf.
Okay, thank you so much. So now, how to verbalize developmental assessment? First, you need to know what are the principles of assessment, and then we will how to verbalize as we are going along. The developmental cases, they are for fine motor, gross motor, hearing, speech and language, and social. So those together, fine motor and gross motor, they called motor. So you need to be very vigilant to the opening statement. It happened many times in the exam to just to get, please assess this child motor skills, and you go assess fine motor only. This means you lost 50% of the case. If the opening statement assess motor skills, this means fine and gross motor. And if the opening statement assess this child cognitive function, this means both hearing, speech, and language and social. Okay, so now Royal College on time of or period of time, so they mentioned no more we can bring you twin. So no more we can bring you twin, fine motor and gross motor, and the task is supposed to be only one area. And even in this period, it was even almost between 2018 and late 2019, recent. So, and even during this period, they never get adherent to this. And there are so many breakthroughs. So this means anything can happen and all chances are equal nowadays. So we have the trend and the fashion of hearing, speech, and language. Social is the least encountered in the new style, and it's the most difficult in the new style. So this is because the people are just not used to talk about the social. It's not difficult by itself, but because people are not imagining how can I go through it. So I'm talking about in general, not about us. So about us, there will be zero difficulty, inshallah. I hope there will be zero difficulty regarding all aspects of development. So here now, this is a brief hint about the developmental cases. We were starting with the vision and fine motor, and you will see vision is written in a very big font. You know why? Because most people are saying fine motor, fine motor, fine motor, and forget to it's fine motor. Even if the examiner told you, please assess this child fine motor, This means it includes the vision, even if it is not pronounced. So that's why, in order not to forget, it's called vision and fine motor, not fine motor and vision. So if anything, usually you forget, make it first and make it big and put some height on it. So it's called vision and fine motor. The introduction, this is the usual for us. We are talking about taking the opening statement, wash your hand, talking to the family, and then selection of toys. And you will see now I'm already on the statement and station, and I talked to the examiner already, and I summarized the history for them. So no place for just taking opening statement. You just tell me, please verbalize or describe for me your developmental assessment as you would do in the clinical practice. So no place also to say I wash my hands, so I can just tell, I talk to the mother, getting permission to play with the child. To play with the child. Don't say to examine the child. You will never touch him. You will never examine him. So take permission to play with the child. And then I will talk to the child, trying to make rapport. While I'm doing that, I will get an impression about, go through the WOW 3 S's as usual, and its pathway criteria. So I need to know he's well, alert, speech, and well grown for his age, for example. And then syndromic features, if I provided already the picture, I can say I will refer to it. So I saw a picture for a child with Down syndrome wearing glasses. Okay, so now I'm wondering about anything in the surrounding. Don't talk about the senses because you have already a picture. Okay, so and I refer to it. I'm wondering anything in the surroundings. No. Then after that, I will go to select my toys. Proper toy selection equal marks. And one of the last few exams, it was in the UK, and the task was the hearing, speech, and language. Okay, or this was hearing, speech, and language. And the examiner, she said, I will go select the toys. They say, what toys you will select? And she mentioned, I will bring, although we make it very easy, but unfortunately she went there and she mentioned that I will bring feeding set, including 1, 2, 3, 4. I will bring toys in the form of cubes. And she mentioned cubes. And you say, what? Why? Why cubes? So she cannot justify the issue. And she mentioned just in order to, anyway, this station does not include cubes. So this means if I did not say that my toys appropriately and showing the examiner that I am having the criteria for care, so this really, although the words are silly, but saying it equal marks, you will see. So number one, I need to select the toys appropriate for the task. This is what we just talked about. So select the toys appropriate for the task. If it is fine motor, and I told the examiner about the bicycle, or tricycle, done, over. 2 marks, if even not more. So you need to select appropriate for the task. Number 2, appropriate for the age. Appropriate for the age. If I am using, for example, picture book, so it's supposed to be showing pictures, animals, so birds, colors, but not a story, okay, not a talk, so a child 3 years, and I bring him story writings. So is it appropriate for age? No. So appropriate for age, we have even in the board, we have something called simple puzzle, and we have something called complex puzzle, So simple about the simple shapes. So triangle, rectangle, so circle. This is the most simple, okay? But numbers, shapes, alphabet, and by the way, you may find some people call it port. So port, and it's not, this is not descriptive. If you just to go here and write what is port, you will get this board, what we are writing on. It's nothing called board, okay? It's called puzzle. And we can say shape puzzle or alphabet puzzle, you will get directly what we talk about, okay? So this is very famous. It's called puzzle note board. Okay, here to just you think it's why I'm saying like that. So we can skip this point. What is the difference between puzzle and board? I'm telling you because I remember when I was first in the Heathrow airport. So I was talking to the officer there, and she's asking me why you are here. I say I'm attending the celebration of the Royal College of Pediatrics. And she said, what? She does not get me. You mean pediatrics? Tricks? I say, yes. Okay. So this means sometimes if I just say port, examiner say, what do you mean by port? It happens. So, but saying puzzle, everybody knows it's puzzle. Okay. So this is number 3 in the rules, supposed to be 1 by 1 to avoid destruction. And you will see here, you will see the child eyes, what is meant by distraction. He's just always concentrating in other toys. So he wants other toys. He's caring about what is hidden. I cannot select toys all together. And this is a trend, and it's written in the mark sheets. Recent trend and written in the mark sheets. So you bring toys all together, and here because it's just in the past it was bothering to go select one toys and return to the child, and then go select another toy and then return to the child. But now I'm just talking. So I will go to the examiner, I will tell him, I will bring my toys 1 by 1 to avoid distraction of the child. I think it's easy, okay? So we are bringing number 1, paper set. So the paper set, and the word paper set means paper group. So paper alone has no meaning, but paper with crayon and scissor, so this now it's called paper set. So the paper, usually we are writing in the paper, and after that with the crayons, and after that, after we finish writing, we cut it. Okay, so this is simple now, although they are 2 things, but we just in order to memory. So the 2 P's, paper set and puzzle. Okay, and then we are moving to the blocks. It's not called the cubes, it's called the blocks. And then beats, big one, and then the book. So this is the 3rd rule in the selection of toys. You see, I'm spending a long time on this issue, although it's silly, I know, but it equal marks. Okay, now the last rule in selection of the toys, you need to be safe. The following are unsafe toys: metal, scissors, so it can cause self-harm. Pens and pencils. We are using crayons, not pens and not pencils. It can cause major safety issue, eye trauma. So this is very bad. Okay, small beads, risk of suffocation. They are all unsafe. So a child may swallow it as a foreign body. That's why we are using big beads. So now I'm telling to the examiner, while I'm selecting my toys, I will bring plastic scissors. I will select crayons, not pens, not pencils, and small beads are not allowed. I think it's quite clear now, the rules of toy selection. Exam table, where you getting to set, you need to know, sometimes we can sit on just a linen on the ground and we can sit on it, or if we have a table, appropriate one for the child, so we can sit around it. Okay, so now sort of the station, I'm going to select searching for the cues of the developmental delay. Okay, here I have a child. What could be the reason of the delay in this child? We will have here, we will learn together that in Down syndrome, causes of the delay is multifactorial. And this is a word we need to say. Reasons of the delay here is multifactorial. But what is most related to me is child has Down syndrome features and she's wearing glasses. So vision problem. So if this glasses, for example, child has long history and she just recently wear the glasses, so this can justify the delay. So I need to know if she has vision problem and if she's following with any ophthalmologist, if she's planned for anything related to the ophthalmology, any surgery or anything. Okay, so what do you think about this girl? So Down syndrome means cognitive issue. She cannot understand and they are known to have developmental delay. She has squint. Okay, so this can mean vision problem, and this can add to the developmental fine motor delay. So if I have a child with CP or hemiplegic child, so hemiplegic child, sure, he can find motor problem. Okay, so I need to know what is the reason for delay while I am playing with the child. Before we play, we need to ask about, I have to look to the child eyes. So, and getting the impression as we mentioned before. And then here, if guidance about the real quality dimension, if your child is syndrome or neuro, so you are not, the purpose of the station not to go and say how many dysmorphic features is he having, or what is the abnormal neurological sign, for example. So CP, I like to, he has colonus, he has a spasm, he has, no, it's not like that. You are not in the development, you are not allowed to touch the child, and you need to get it, the issue collectively. So if I have a picture showing Down syndrome, that's it. This is, my job stops here. So features suggestive of Down syndrome. Let's play. What is the most important toy to start with? And we talk about the crayon. So why the crayon? Because we get 5 benefits of the crayon. Number 1, eye alignment. So I'm saying to the examiner, I am applying or I am bringing crayons, and then I apply it at the level of the child's vision. So this is very important, so I can see his eye alignment. Okay, so if the child, if I give it to his hand, the child's eyes will be closed this way, and I will never be able to judge his eye alignment. Is he having eye problem, squint problem, anything? So number 1, I will try to gain the child's attention and introduce the crayon at the level of his eyes, so I can see, I get an impression about his eye alignment. Are there any problem? No. Number 2, this is eye alignment. This is a child who has squint, so I can get it now. Number 2, color vision. And you need to justify that to the examiner. So especially the British and Indians and those people appreciate this issue very much. So color vision. I will assist the examiner. I will ask the child about the colors of the crayon. So which color that? So assess his color vision. So this is very important. If it is an Arabic examiner, you can skip this point. You can skip this point. So they sometimes misinterpret this point. So color vision. So I'm asking about the child about the color. What color is that? So which color would you like to play with? So he said the red, the blue. So where is the red? So now I can see this, the child has no problem in color vision. Then handedness. It's thankfully I can claim we are the first one to talk about the handedness and introduce it into the recent trend in the exam, and tell the examiner I have a mark sheet in from the UK saying the examiner was extremely happy when it was interactive. The examination including cases, and the candidate went there and intendedly give the child the color in his left hand, and the examiner was extremely happy about that. And this is, we are saying very important, before I play, I will give the child the crayon in his left hand. So I will tell him intentionally. So I will do that. I will give the child the crayon to the left hand, and I will see if he's able, is he using the left hand or he transferred to the right. So now this means I can get an idea about his handedness. If the child is using it with the left hand, like that, so either he is left-handed or he's hemiplegic. So a child using his left hand, either he is left-handed or hemiplegic. And both of them needs reporting. How can I differentiate between them in playing? Between left-handed and between the hemiplegic. Hello?
Are the movements of right hand, whether he is moving his right hand or not?
Okay, so this is one thing. Now he's using it with the left hand. Is he using his right hand for support? So, for example, catching the paper, supporting anything. So,
Yes,
is he?
yes, then he is left-handed, otherwise no.
So, even the left-handed, the right hand will be moving. He will use it for other tasks, like supporting the paper, supporting the things. But no right-handed is by his side and he's not using it. So, I would think of hemiplegia. Okay, so handedness, and this, they are all very important and equal marks. Last exam, the online examiner will keep asking, the candidate was not aware of what we are doing, and he just went there do the games. Okay, I will give him, and I will see, is he able to scribble? So the last thing is the drawing. No, he forget about all this, and they say, what else? What else? What else? What else? So we are here to assess vision and fine motor. So eye alignment, color vision, handedness, and the grip. So grip, drawing, and writing, these are the 5 benefits of the crime. Grip important, and again, yes, definitely it's important. And I remember when I first stressed on the importance of the crime. So people in the general groups and in the public groups saying, oh, it's exaggeration. Dr. Yusri usually is fond of making things complex. I say it's okay, up to them, and they will discover this later. Now they are all talking about the importance of the grip. So because I have no preferences. Why I'm bringing this mark sheet, you see, written here, did not comment on the finger grasp. And in another mark sheet, if you want 500 mark sheets talking about this issue, did not recognize miniature grasp. This is another one. Okay, so I'm just transferring the examiner preferences. Examiner nowadays, they want you to comment on the grasp. So that's why I will just ask him. Now, I need to know what kind of grasp child is having. So here they mention palmar grasp, and from the word, so usually don't memorize. My advice, take the cue from the word. What is meant by palmar grasp? From the word itself. So from the word, it says that
Holding the object in the whole palm, like using the palm.
Okay, that's it. So he using 5 fingers against palm. 5 fingers against palm. So palm is a part of the equation. While pincer grasp or pincer grip. So pincer means, you know the pincer? So just to show you what is pincer. Part of tool, you know, this is the pincer, okay? And the pincer is quite clear, it catches objects between 2 points. This is the pincer. Okay, so that's why pincer will be index against thumb. And we have what is called inferior pincer grasp, and we have the superior or the neat pincer grasp. So this is 9 and 10 months, and the limit age for this one is 12 months. So pincer between 2 points, index against thumb, and the inferior or crude, you know, he's not between the points. It's between the edge. So that's why they call it inferior or crude, not refined yet. But you see now, if it is between the tips of the fingers, so it's called superior or neat. So neat in the language of Jordanians and Palestinians, they call مرتب. Okay, so something neat, organized, well done. Okay, so this is pencil grip, superior, neat. This is the usually achieved at the 10 month, and the limit age are 12 months. So this is the finger grasp. Number two, we are talking about the grip. So grip and grasp, they are grip, hand grip. This is very important. You will see here the fist grip, fist. So you know the fist one, like he's playing boxing. Okay, so the fist grip. So a child, usually what happens here in the fist grip? So a child is catching the things in his fist, in the pencil in his fist. And here in the quadruped grip, quadruped. So quadruped means 4 fingers against thumb. They have many names. Quadruped is the most easy. So I have quadruped and I have tripod. Quadruped again, 4 fingers against thumb. Okay. And this one has a name, it's called the digital pronate grip. So digital pronate grip. So digital means fingers. Pronate, so they will start to face the paper. So the digits will start to face the paper. Okay. So here, this one, you will see they mention another name for it. It's called the palm supinate. So the palm is supinated, and there are, the child is, if I have a paper here, so child hand is neutral. So the fingers is not facing the paper. So fist grip or palm supinate. I have this one, digital pronate or quadruped, and the British people like to call it primitive tripod, primitive tripod. Okay, and here we have the adult shape. So adults, and you will discover that age of skills are 3 years. So now, from now, we will start to discover that all skills and good things are acquired at the age of 3. Before that, they are all very primitive trials, but age of 3 is the age of wonders. Okay, so now he will start to have the tripod grip. What is the meaning of tripod? 3 fingers against thumb. This is the tripod. So sorry, 2 fingers against thumb. So that's why he's catching it using 3 fingers. So that's why it's called tripod. It's an adult grip, the same. And here you will discover immature or mature. And this is important. Yes, they are important. So immature or static. Static means what? Means the wrist is static. And the movement is from the elbow. The movement is gross motor. So the more the child grows, he will eliminate the gross movement, and he will start, the movement will be from the wrist and the fingers only. That's why we call wrist and fingers are dynamic. It will be at the age of 4 to 5. Let's start to apply, having some exercise. So now I will just
nearly try one more time, like that, and then like that.
What is the kind of grip? Now, here.
Job, brilliant, well, yeah. And now let's see if you can do this. Can you draw a square like that?
So this is for ourselves, just to understand. You see now, what is the kind of grip? This one. What do you think? You can write? You can type for me, fist grip. You are all amazing. Thank you all. So nothing in the screen. What is nothing in the screen? Here, this grip, hand grip. So you see the video, Dr. Ayman? I think they all. So if you cannot see my screen, so just to go out and then join again. Yes, leave and join, yes. Full fine motor in progress. Okay, so now I'm talking about it's quite in the screen here, so I can see that child has fist grip. Why I say fist? So it's neutral, palms are not facing, and he's like boxing. And again, what he's able to do. So this is the fist grip. What he's able to do, let's see.
Jack, you're starting with some drawing, are you? Can I see what you can draw? Oh, you've got a nice palmer grasp with that pen. And do you think you can draw a circle for me, Jack? Let's see if I draw one. Oh, you can. Oh.
So here she mentioned he's able to draw circle. What do you think? This child is able to draw circle? Yes or no? Again, I will show it to you again.
Can I see what you can draw? Oh, you've got a nice palmer grasp with that pen. And do you think you can draw a circle for me, Jack? Let's see if I draw one. Oh, you can. All by yourself. Brilliant.
So now he just to do like that. He do like that. Tell him about circle, he do like that. So Dr. Man said, yes, he can. What do you think, guys? Is he able to draw a circle? Or no? So yes, you are all right. It's not a circle. Dr. Halima say, yes, he can. So I did not see him. Dr. Amina say, I did not see him drawing. Again, see him.
Let's see if I draw one. Oh, you can. All by yourself. Brilliant.
So no, he cannot. So this is called circular scribble. So circle means he must have a start and end. But if he just to continuously do like that, no start, no end, this is called a scribble, not circle. Okay, so no, he can. Circular scribble, what the age of the circular scribble? Usually we will see now in the table, age of circular scribble, yes, appropriately, almost 18 months to 1.5 to 2 years. So, and this is child, so his fist grip 1 to 2, so they are going together. So what he's able to draw is going along with his kind of grip. Okay, so this is another thing. Let's see another child.
Jack, can you come and do a bit of drawing for me? Now, could you, if I give you that one, and we have this one, could you draw a circle for me like that? Oh, can you go all the way around? How about a circle like that one? Can you manage that? Do you want to use, that's it? Oh, good lad. Now, Jack, hang on just a second, my lovely boy. Well done. Can you draw a cross for me like that? Hey, that's very good two-handed drawing we've got there. Excellent. Excellent. Well done, my lovely boy. Now, do you want to come and have a look at this book?
So what kind of grip? Amazing. Quadruped, yes, quadruped. Another name, primitive tripod. Okay, so that's very good. Quadruped, will. And quadruped, I say from the age of 2 to 3, and what he's able to draw. So, no, it's not a circle. So still, this is not a circle.
You go all the way around. How about a circle like that one? Can you manage that? Do you want to use, that's it. Oh, good lad.
Still circular
Now,
scribble at the age of 2, so it's appropriate. So 2 and quadruped, so this means he's on his way. So now we are talking about one thing important in this child. Vertical line, it's okay, vertical line before, yes, he can. So the quadruped, if you see, the child is catching here, the fingers are facing the paper. So the more advanced, so you will start that fingers will face the paper, but it's not adult yet. We are not, me and you are not catching the finger, the pencil this way. See this girl?
We do banging bricks, but we can always do banging crayons if you like. Good girl. Well done. Do we happen to have any paper since she has a crayon in her hand? Good girl.
Mamá.
Well done, you're showing mummy.
Sí, mi amor, juega ahí.
Well done. Can you have a go like that's it. Well done. And what about, good girl. Well done. What about like this? Esmeralda. Huey. What about like this one? Can you do one of those? Well done.
You see here, there is one thing, because it deceives some people. When she starts, she deceives you like she will gonna catch it adult way. But it's not an effective grip. The effective grip is the one she used in drawing, which is...
That's it. Well done.
What do you think of this grip? So is it fist? Is it quadruped? Is it tripod? So imagine tripod. Ask yourself: do you catch the pen this way? Do you other type? So very good, Dr. Sugaina. This child has gusting, banging, and this is quadruped, fingers facing, and it's not other type. So it's quadruped. Okay. So what the child is able to draw, again, scribble. So let's move into a little bit advanced. What about this girl?
which colour is that? Which colour is that? Which colour is that?
What colour is it?
Blue, very good. And what colour is this one? Red, fabulous. Do you want to have the red one instead? What colour is this one? Excellent. And last one, what colour is that? Green. Can you draw a circle like that for me? Oh, that is brilliant. Now, can you draw a square like that for me? Oh, lovely. Fantastic. That's great. Can I turn this page?
Now, what kind of grip? Right-handed, tripod, circle. Very good. Tripod, but you did not tell me tripod, mature or immature. So thank you. All of you are amazing, static. All of you, very good answers. All of you just, yes, it's adult type grip. We are catching the pen this way. And this is now, you see, child, see the whole movement of the hand, of the arm. So see the whole movement of the whole arm is moving, you see, while she's drawing, whole arm is moving, means it's immature. So the mature one is just resting the arm on the paper, and what is moving is the hand fine motors only. As long as it still has gross motor element, it's called immature.
Oh, that is brilliant. Now, can you draw a square like that for me?
So this means her age is 3 to 4. And now what she's able to draw, she drew already a circle, and you see now the circle has a start and has an end. It was amazing and quite brilliant. Now the difference between circle and circular scribble. And now when you ask her to do a square, is she able to do? No. So this is what she did is not, I cannot say it's a square, because in order to make a square, what she need to do? what she have to do in order to say it's a square.
Vertical and horizontal lines both.
Okay, so angles. So the angles not to be, acute angles. So 4 angles, yes. In order to say it's a square, it must have at least the shape of 4 angles. But this one, no, it does not resemble square. So this is a static tripod, the last grip for today.
By the age of 6, a child can hold a pencil in a similar way to an adult. This is called the dynamic tripod grasp. This girl is drawing a person.
You will see now the child is, all the movement is coming from the wrist and from the fingers. Hand is resting on the table and it's all pure fine motor, you see?
Dynamic tripod grasp. This girl is drawing a person.
So this is now, it's called dynamic or mature tripod grip. You will see some differences between the ages between sources. Some saying, but it's totally from the age of 4. It's accepted from the age of 4 after later on. This is another girl. She has a dynamic.
I haven't brought the camera.
So just to show you that she has dynamic.
Lovely. That's great.
She's writing letter A. Ask her to write letter A, she writes.
Can you do me a big B?
Big B.
What about a big S? Terrific. Aren't you great at that?
Okay, so this is now we know about the grip. And I think now the last thing to do is about drawing and writing. So drawing and writing, we have, you remember all of this as a mnemonic. It's a very famous vertical lines at the age of 2. So we are just drawing a child or a girl with, she's wearing a skirt. So now vertical lines 2, horizontal lines at the age of 2.5. So circle at the age of 3. So cross and square at the age of 4. Some people saying cross at the age of 3.5, which is more appropriate, cross at the age of 3.5, and then a triangle at the age of 5. So this is now how many parts? Body parts. 3-year-old is drawing man 3 parts. So man 3 parts is just a circle and the 2 lines like that. And if it is man 5 parts like that would be, this is again at the age of 4 years. And we mentioned, to make it easy, any details in the face will put the child immediately at the age of 5. So this is now any details, eyes, nose, mouth, hair, any details on the face will put the child immediately at the age of 5. And here, if you just saw what the child is able to draw here, we are talking about the grip.
By the age of 6, a child can hold a pencil in a similar way to an adult.
I think now you can anticipate even before she complete any details on the face, she's more than 5. Okay. So that's very, very easy now. So how many parts? How many body parts? So man 3 part at the age of 3. So 5 parts at the age of 4. And any details on the face more than, you see now 5 years can draw a person with at least 6 body parts. So any details on the face, eyes, nose, mouth, and hair, this is head 4. Then still remaining the other things, he will arms, body, legs. So that's why we consider every arm is a part. So this means this man is at least 6 parts. So this child is 5 years old. After drawing on the paper, cut it. So usually we are using the scissor, and please make sure that you know the milestones of the scissor and the meaning of the scissor, because it's a requirement. Yes, I understand it's not universal. Not all the examiners know about the scissors, but there are hawks who know the details of the scissor, and it's not popular. It's not written in the books. It's not famous. So that's why you need to just take it copy and paste, but please don't share any material belongs to me with others. I consider it a matter of honesty. Here at the younger than 2, he just hold with both hands and he does not know the function. 2 to 3, and he's not 3 yet, he catch appropriately but again, he does not know the function. He does not know how to use it. And again, you will discover age of 3 is the age of miracles. So from 3, he starts to know the function. Age of 3, in everything, age of 3 is completely different. So single cut, he's starting out to know the function. And 3.5, so uses the other hand to hold the paper. And 4, he cut in a straight line, multiple cuts in a straight line. And at the age of 5, we are saying this is at the age of 5, usually he starts to be marvelous. He becomes to start expert, skillful, very, very skillful. So higher skills at the age of 5. So writing letters, complex shapes like diamond and things and triangles and things like that. So they are all older than 5. So older than 5 is the higher skills. Okay. So now you will discover by the time I don't have to memorize milestones too much because I understand now age of 3 is the age of function. Age of 5 is the age of higher skills. So I can anticipate most of the skills now without memorization. So let's apply. This is how old this guy.
Move on to drawing wavy lines or complete circles. Before you know it, they'll be craft experts.
So this child, how could you consider, is he knowing the function or he does not know the function? So in the exam, even if he's trying, this means he knows the function. So even if, because the plastic, if we as an adult, if we try to use this plastic scissor, it does not cut. It's so bad. So that's why a child is crying, he's making the opening, you see, he's open and close and he's trying to make the cut. So this means he knows the function. So how old this guy? Let's see, are you concentrating or no? Bring the difference, concentrate on the shapes, I'm sorry. 4, 4, 4, 4. Does he cut in a single line, in a straight line? It's a single cut. 3, 3, 3, 3. Who will get the middle of honor? 2 to 3? No. Three and a half. Wow, that's good, Dr. Rama. So you see the other hand, he's supporting with the other hand. So this child is 3.5. So long ago. It's a single cut. It's a single cut because he's not skillful yet. You will see the difference now, the one who is cutting in a straight line. But this one is just trying to make his first trial, just opening and closing, and he knows the function, holding it appropriately, single cut, holding with the other hand. So he's 3.5. Okay, see this girl. So now this is really, and this girl is 2-year-old Filipino girl. See now and tell me about her developmental age. So there is a difference now between chronological age, she's 2 years old, and the developmental age. So you see the first part of the cut. What do you think? Wow, now we know the difference. Yes, very good. All of you, very good. It's clear to the point now. So 4, all of you write 4, 4, 4, 4, 4, 4. I'm happy anyone write more than 4. Somebody write 5. 3.5. No. So it's continuous, multiple. So this is it single or multiple? Multiple cuts straight in a line, multiple cuts straight in a line. So this is 4. 4, yes. Okay, so now this girl, you will discover in many cases there may be discrepancy between chronological age and ages of skill. I may have a child who is 5 and is not able to even catch the scissor. Okay, and examiner will ask me, what do you explain that? So he's able to do everything in appropriate age, but he has a problem in the scissor only. So in terms of all skills, he's 5 years. But in terms of the scissor, no, he cannot even catch it. He does not know the function. So I will say this is developmental delay, or what? What do you think? Not introduced, lack of training. Excellent, excellent. It's lack of training. Not familiar with that. So lack of exposure or lack of training, that's it, exactly. So I have, this is what we call justification. So the examiner now can ask me, what do you think? So this is maybe his first exposure, and there are lack of training in terms of using the scissor. That's it, it's explain the issue. But the child is totally normal, okay? Now using the puzzle and the board, just making 3 simple shapes. This is the puzzle, making 3 simple shapes. It will go with the child age 3 years, so 3 with 3. So completing all the simple and at least 3 of the complex even could be at the age of 4 years. So this is the puzzle, 3 years is able to do 3 or 4 pieces of the simple shape. Okay, and the blocks, moving into the blocks, you know, blocks, tips and tricks, cubes station. They calling it cubes station. The fine motor is cubes station. You know why? Because you cannot complete the station without doing the cubes. If time is up and you did not mention the cubes, this means you failed the case completely. They consider it, this is the nickname for this station. It's called cubes station. So it's very important. You need don't correct the cubes position. So if after the child introducing, don't correct the cube's position, and introduce 1 cube from the right side and 1 from the left side. This is for the purpose of the assessment of the visual field. Okay. Here you will see the cubes. Let's take.
What do you do with those? Have you ever seen those before? At least when I look at them, we can make. Oh, have you done a bridge before? That's a little bit like a bridge. Should we try just a tower first? Let's see. Ooh, very good. So the train can go through the bridge. Oh, you can't get through. That's it. Oh, nearly. Good girl. Leave a little gap for the train. Well done. Okay, that's.
So you see now she's trying to tell her a meaning of the train. The train cannot go through it. So because they are close together. So it's a can give you an idea that the child is in the early 3 years. So in the early months of the 3 years, he's not advanced yet. So if you know the meaning of the bridge and you leave a space for the cars or the train to go through, so this means he's in the late 3. So how much? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. Oh, that's good. So now, anybody notice anything in this child? How much of the developmental age? Anything you noticed? Let's see the people. Chat, please, write for me. So what is the age? Anything else you noticed? Hearing aid. Where is the hearing aid? It's fine motor. I cannot see hearing aid. No, I cannot see any hearing aids. So she's, wow, Dr. Ibrahim, very good. She's using both hands, age 3 to 3.6 to ridiculous. No, 3, let's say 3. But what else? Excellent. You get the meaning of, you start to get the meaning of the fine motor. What about the grasp? So the way she cuts the cubes. So is it crude or is it fine? For me, I see it's very fine. Okay. So this is a 3-year-old. We commented on the hand, we commented on the grass, but then the beads, we are not using the small beads. So at the age of 3, he's able to make the beads, the big one, only 2 only. And at the age of 4, he make it 2 and fro at the age of 4 years. So 2 and fro means if I have a bead like that, this is the opening. Okay, and this is the other opening. So going with the strange on it and then coming back again. So this is in the same opening, it's called to and fro. Okay, so this is the beads. And the last thing is the book was controversial and making a lot of troubles in the past. Some people does not consider the book as part of the fine motor assessment. You need to be very careful while you are saying. So just to say the book and say about the colors, how much he turning the page. So usually the book, if we see the table, the book is usually talking about age 1 to 1.5. So turning single page or 1.5 and 2 years. So single page or multiple page together, that's it. But there are other uses of the book here, just to see.
Is it okay with you if we have a look at Katerina's development and just do some playing? What have you got in your book? That's very good.
Who's in your book, Katerina?
Who's that? You don't know? It's a girl though, isn't it? And you can see what's on the next page. Good. You turn those pages very nicely. What about some colours? Can you tell me that colour?
So she's talking about color. So in the last also scenario, Mark Petty, so it's talking about the colors. Colors. So you get the point. It's a part of the fine motor assessment. That's why you need to consider that. I can use the book for turning the pages and as well for the color vision. So 15 months, turn many pages at a time, and 2 years, turn a single page one by one. And also can be assessed for near vision. So near vision and assessed for color vision, what color is that jacket. This is the things we can use the book in the fine motor and vision assessment. And this is very important, especially if you are met by overseas by a British or Indian examiner. They appreciate this point. Overseas, you can just, according to the situation, just say it, and that's it. I know one of the candidates in Emirates, he he has many trials in the exam and he's an unlucky guy. And he say in the first trial, I'd like to use the book to assess fine motor and vision. And the examiner say, you are using the book in fine motor and vision, and he deduct 2 marks on this point. If he get the 2 marks, he will pass. Next trial, he did not mention the book, and I have the 2 mark sheets. And the examiner tell him, you did not mention the books. It was, very unlucky. And he again cut 2 marks for this point. So at the best, using the book or not using the book, now it's written clear cut in the official website. 4-year-old hemiplegia, please gather relevant information history regarding fine motor skills. And then they mentioned the picture book in the assessment of the fine motor skills. It is now quite clear it's a major part in the assessment of fine motor, and it's written officially in the site. Now we are talking about the table. You see, we are talking now how to recall and how to make it easy for us to recall the findings and present them clearly in the exam. Okay, this is the worst way anybody can study with. By the way, this is my own notes. I wrote it a long time ago in 2013, and then I made this table later on. So just to study using the multiple lines, at the 6 months he's able to do, at the 9 months he's able to do, and finish the grade, moving to the copying, and then after that his hand dominance and scribble, and what he's able to do, draw and copy, line and trace, and this. If you follow this way of studying, you will never be able to recall the age, because what happens, I get the grade and I see this is the age of 1.5, and then the dynamic, and then I forget to scribble at the age of 2, and then here 4, and then here is 3, and then when you try to recall what is the first one, I cannot. So that's why it's a very difficult using this way to study fine development. The best way to study the development is to study it as a table. And you will here find the table, you will have the age of 3 is highlighted in yellow. You know why? Because we mentioned this at the age of skills. And I am measuring each child in my mind, does he, go through the age or reach the age of 3? For me, this is considered like the wall, or is he able to jump over it, or no, he's yet in the area under 3. So he's still here in this area. So that's why I am measuring every child against the age of 3. And I'm taking it one by one. By the way, you don't have to make it a screen capture because I will share all the schedules of fine motor tables with you in the group. Okay. So now I'm going inside. I'm making the crayon 5 things about vision, grip, draw, and write. Okay, so the 5 things related to the crayon. And then while I'm doing this, I see the grip. He's telling static tripod, for example. Once he say child is having static tripod, so I say this child is in the area of age of 3. Okay, and I will start to compare the next common things. Writing and drawing, circle. This means he's still 3. And regarding man 3 parts, no, he's not able to. And single cut, yes, he's doing single cut, so he's still 3. So tower, yes, tower of 9, for example. So you know how we are calculating the tower. So tower, we did not talk about this point. So at the age of 2, he's able to 2 cubes only at the age of 15 months, 3 at the age of 18, and 6 at the age of 2. And from later on, so just to divide the number of the cubes on 3, he will give you the age. 6 on 3 will give you the age, 9 on 3, so the child will be 3. So 12 by 3 will give you the child age 4. Okay. So now what I'm getting that I'm trying to collect my mind, the child is homogeneously going with 3, 3, 3, 3, everything he's doing at the age of 3, and I'm happy with it. So I can recall him easily. The other possibility I'm getting is I have a child who has a static tripod, for example, but he's not able, he's just doing like circular scribble. And he's catching the scissor, but he does not know the answer. He do the tower of 9, and he do train and bridge. Okay, and he make 3 simple shapes, and he did large beads. So in my mind, what I'm saying this child is going 3, and then there are 2 things at the age of 2.5, let's say, and then again 3, 3, 3. It will put a light on the importance of we are taking the average. So why we are assessing 6 areas of development. If one area can tell me about the age, why then I am assessing 6 areas of development or 6 skills? Because I'm caring about the average. Okay, so the average of this child, he's almost 3. So I can say he's almost 3. So I can say 2.2 years, 9 months, for example, or 2.5 to 3, but he's closer to 3. Am I right? It's an important point to consider. We are taking the average. A third possibility that I have a child, I'm sorry, Discord. So I have a child who is a static tripod, circle, and then he cannot do the scissor. He cannot know the function, and then tower and 3 shapes and large beads. What age I will give? So this is definitely 3. I will give the age of 3. Okay. And what about he's not able to use the scissor, lack of exposure. Okay. So now I am measuring my child against 3, but if the third possibility or the fourth possibility, I have a child who's just, as you saw, he's having a fist grip. And he has to and fro scribble. Okay, so he does not know anything about the scissor. Okay, just to open and close with both hands, or does not know the function. And then he can do only 2 or 3 cubes like that. So 2 simple shape, multiple. So this means I have an average in my mind saying your child is almost 1.5 to 2 years. So taking it vertically, so usually it will be amazing if you study the table and you know the side of everything you are doing, where is in the table by the photo memory, because you remember when we are younger, we remember that 1.5 was in the left. And then at the age of 2, he's able to do 1, 2, 3, 4. I'm taking them vertically. And at the age of 3, I know this by my heart. So I know usually for me, when I'm trying to revise the development tables, what I'm doing. I'm saying that the first thing, I will go there. So introduce myself, get the impression, all 3 S's. And then I will go introduce between me and the child, see the alignment. Then after that, ask him about the color vision. Then handedness and grab. Then I will ask him to draw and write. At the age of 1.5, so fist to grab. And he's able to do nothing, no drawing, nothing at all. So 1.5, to and fro scribble, okay? At the age of 2 years, he's doing quadruped, and he's able to do circular scribbling, line vertical and line horizontal. I know this from the picture, it's not difficult. Then at the age of 3, once I reach 3, I take it vertically. So static tripod, circle, man 3 parts, single cut, tower of 9, train up bridge, 3 simple shapes, large beats. I finished the revision. You know why? Because that's it. If I have a child who is showing more advanced than that, he's 4 or 5, and it's easy. So 4 will be dynamic, and he's able to make things which is a bit more complex, cross, square. So from the shape, you remember the girl. So she's wearing the cross, and this is now it's easy to know about the shapes. So cross and square at the age of 4. So she's able to draw man 5 parts. So and she's able to cut straight line, and that's it enough. No need to do this straight line. Tower 12, stairs 6 cube, small stair. So tower of 12 and small stair. Small stair means 6 cube. At the age of 5, so triangle, man 6 parts, shapes, tower 15 and the big stair. And usually they will. This is the age the least to be seen in the exam. The least to be seen in the exam. So if you bring your child 5 and he's able to do 5, so you get the points. So what is the problem then? Appropriate for age, reassurance, referral, nothing needed. What is the team? No team, nothing. It's normal. So that's why this age is the least. So why I'm bothering myself? I know the age of 3 by heart. So every day I'm saying the age of 3 is able to do 1, 2, 3, 5, 6. If he's not able to do these skills, this means he's younger than 3. If he's able and more, so he's usually almost 5. So this is the way we are studying the development. Table is the best, and go vertically, and know your age limit, the things you are measuring against. So we are following the scale approach when we are talking about the average. So if I have a child, grip and drawing and cutting, and here this is an example. Child having static tripod, and he is able to do circle and single cut. This is a puzzle for everyone. Static tripod, circle, single cut, and he's able to do a stair. He's able to do a stair. So what's the age you will give him? So what the age you will give him? This child. Three. Ooh. Please. 3.5, 3.5, 3 to 3.5. Excellent. It's okay. 3.5. Yes. 3.5. No. 4. No. He's not yet 4. You know why? Because we mentioned the average. So he has most of the skills at the age of 3, and he did only 1 skill at the age of 4. So he did not reach 4 yet. So he 3 to 3.5. I can say he 3.5. Yes, it's okay because I have, but he's not 4 yet. Single skill at the age of 4. So it will go, this plate will go a bit heavier in this in this area. So it will bring him more to the age of 4, but he's not 4 yet. My singular pillar at the age of 3, رمانة الميزان. So everything at the age of 3, and he have only one skill at the age of 4, so I will give him 3 to 3.5. Very good. But if again he's doing only tower of 6, no bridge, and nothing at all. So only no train, no bridge, only tower of 6. Tower of 6 means the age of 2. So what age I will give him? What age I will give him? So it will be 3 years. 2.5, 2.5, 2.5, yes, yes. So I can say 2.5 to 3, yes. 2.5 to 3, yes. So what I'm telling to the examiner that child did 3 skills at the age of 3, which is static tripod, circle, single, cut. And he did 1 or 2 skills at the age of 2, which is tower of 6. So the average will be almost the age of 2.5. So this child developmental age will be 2.5 to 3, can be 2.5 to 3. So I'm telling him he's more 2.5 to 3. So maybe 2.9, 2 and 10 months in this area. Yes. Now in the discussion, I finished developmental assessment and we are in the area of discussion. How I'm verbalizing this issue, I'm going to the examiner describing for him the technique I did. So I go to the room. After that, I will bring the crimes between me and the child at the level of the child. I to see about the eye alignment problems like squint. No. Okay, then I will ask the child about the color to assess color vision. Is he able to define the colors? No. Or yes, no issue. Okay, then after that, I will assess the child handedness by giving the crayon to his left hand. And I will see, is he using the left hand or transferring to right? Is he using both hands? Yes, he's using both hands. And he has dominance to the right side, for example. So this means he's not hemiplegic and the child is right-handed. What about the grip? So he is having palmar grasp. Okay, now I will see what he's able to do. So I will give him example by drawing a line. Is he able to do so? Vertical line, horizontal line. So usually in the development, take care of this point. Take care of this point. Words examiners like, which is stretch the child ability, or challenge the child ability. What is that? I give a child and I draw a line, he's able to draw a line. Then vertical, yes. Horizontal, yes. Draw a circle, he's able to. Square, he's able to. Triangle, yes, he's able to. Letters. Never stop and let the child do. Always challenge him, don't stop. As long as he's able to do, move to the next. This is called stretching the child abilities or challenging the child abilities. So now if I just he's able to do circle and I stopped, can I be sure that this child is not 4 and not 5? I cannot. So as long as the child is able to do the task, challenge him and stretch his abilities. Okay, but if the child stops at the circle, so I can get an idea about his age. He's almost 3 and the next will either support or do so. So can you draw daddy for me? I will ask him to draw a man, draw mom, draw dad. Then yes, he's drawing how many parts? If he say yes, he's able to do, so tell him, I know how many body parts. This means it's not a matter about he's able or not able, but if he's able to do so, how many body parts? This means I know. So this is saying man 5 parts. Okay, now I will give him, I will take the pencil. So I will take the crayon and then hide it away and then introduce for him a scissor while I am catching the paper for him. So I need to catch the paper for him. I will ask to cut the paper. Is he able to hold the scissor with one hand? Yes. And he knows the function? Yes. How many cuts? Single one, single cut. So again, he's a 3-year. Okay, so this will be enough. I will take the scissor. So I will take one and introduce the next. I will take the scissor and then introduce away from his side and then I will introduce the new cubes. Then I will show him how to make a tower. Is he able to do so? And you will start to verbalize and describe the things for the examiner, the things what we are doing. And in my mind, I get this child 3, or no, he's younger than 3. And if he's younger than 3, which area? So is he 1 or 1.5, 2 and 2.5, which area here? So I will be able to follow my vertical approach, so to know where is the child. This is the only way to study development. We have an advice for everyone. Tables need to be revised at least once weekly, And if till you have only 3 weeks or 2 weeks to the exam, so you need to make the revision daily. With the morning coffee, you just, while you are drinking the money, you are revising the tables in your mind. So go horizontally till you reach the age of 3, and then take them vertically. After that, you can make games. What about the age of 4? So challenge yourself. He will able to do 1, 2, 3, 4, 5, 6. What about the age of 2? He's able to do 1, 2. This is done, fine motor and vision. Believe me, if you do so, all the tables, the 4 tables, you revise them in 10 minutes. In 10 minutes, 15 minutes, while you are taking the morning coffee. So I don't have papers, I don't have anything, they are all in my mind. But every day I'm revising them, so the technique is clear in my mind, and I know what are the ages, so you will get the habit. So this is how we are doing with the development. Moving, anything before we move into the hand skills. So hand skills, now this is written the 1 minute. There is one slide list here. Ooh. It's here as well. Okay, so this is now the slide we're searching for. Let's put them here. So now we are talking about the how to recall and presentation. So we talk about the recall, and what help you to get the recall easily is studying by the table, not by the points. And then how to present, we are dividing the talk again. Generally, I'm talking about today I examined a child. She's well alert and she has features of Down syndrome and wearing glasses. So the 4 phrases of fine motor must be mentioned, which is child vision is grossly normal, but I'd like to do formal eye assessment. Chronological age of the child is 6, and developmental age of the child, she did a 3 task at the age of 3, which is, and she did a task at the age of 4, which is, that's why I give her developmental age of 3.5. So she has right-handedness and she shows immature grip. And to complete my exam, I'd like to do the HCVB. Okay, so what is the HCVB? We are talking about other areas of development. So if you assess the fine motor, you must assess other areas of development. And if the child has something which is obvious, I'd like to do complete assessment. For example, She's wearing glasses. I'd like to do formal eye assessment. She has hearing problem. I'd like to do formal hearing assessment. Okay, ENT examination. So this is according to how to complete my exam. And if the child is associated with systemic problems like Down syndrome, I'd like to do head-to-toe examination for systemic manifestations associated with Down syndrome. Child is hemiplegic, I'd like to do formal neurological assessment. Okay, so according to the case, this is how we are presenting cases and after finishing the developmental assessment. So I need to be trained on this. This is very challenging, how to say it in a time fashion. Again, the last thing about the discussion. So you will see here, this is the 6 domains. We cover them all. So information gathering and history taking, physical examination, identification of sign, clinical reasoning, management planning, rapport and communication style, the 6 domains, 12 marks of the development assessment. Discussion will be about the diagnosis, or if the diagnosis is quite clear, what are the causes of delay? It's beef, and we will see it now. And what are the investigation you would do for this child? And what about the management plan? This is the 4 classic questions, no more than this. So here, usually we are searching for the cause of delay. Cause of delay could be physical, could be environmental, could be emotional, could be familial, and it could be multifactorial. If it is syndrome, you can consider multifactorial causes. Multifactorial. So physical, this is the beef causes of delay, always in any part of the development, fine, gross, social, hearing, speech, and language, they are 4. Beef. So physical, central like CB ataxia, or peripheral like muscle, bone, or chronic illness. This can affect gross motor. So senses like visual impairment or hearing impairment, syndromes. So this is again, because syndromes are associated with delayed acquisition of skill due to abnormality in the cognition known with the syndrome. Environmental like malnutrition, or if it is hearing, speech, and language will be, for example, multiple languages in the environment or lack of exposure. So mom is a busy mom and nobody is talking to the child. So a child is just left for the TV. So lack of exposure, lack of training, this is environmental. Emotional neglect and familial could be, they are known to have familial delay. So this is the causes. I have a case of Down syndrome. So causes of delay, when you will see it's multifactorial. So vision problem, part of the syndrome, hypotonia. So hypotonia can affect the fine motor development, environmental issue, lack of exposure, neglect. So all of these are in the area of, so it's not only a single factor, they are multifactorial. And you must say this word to get them all. They are multifactorial. Investigation for the developmental delay. What you saw here written in the box, you'll see assessment EMT of the lab, and they write a list of the lab, blood, like CBK, thyroid function test, ask about heel test result, genetic, chromosomal, genetic fragile X investigation, metabolic screen, urine for GAGs, reducing substance, so too much imaging, MRI brain, EEG if epilepsy. So this is investigation for the developmental delay. If you say like that, you will be punished. So how to say it? We say it investigation of the developmental delay. If the child is okay, so plus or minus 6 months, nothing is needed. So no investigations, reassurance, instruction, teaching. So reassure the mother, teaching her, okay, about what she needs to do, and follow up. So follow up, this means I have a child within 6 months, could be normal. So mother is not training. I will tell her how to play with the child, how to teach him, and give her appointment after 1 month. Let's see, is he fine now? Yes. If not, or the delay is still too much or get severe, so I can transfer. So this is if a child is okay, but if the child show a significant delay, what I should do, say there are no routine investigation for the developmental delay. And the investigation should be guided and tailored by history and physical examination. Okay, so I have a child Down syndrome. While to do GAGs in urine. So GAGs, glycamino acid, glycans. You remember this GAGs of glucopolysaccharidosis, am I right? So reducing substance, why? So it's not relevant. So if you mention things which is blindly written in the book, you will be punished. So I need to say it in a more efficient way. Then now we are talking about the most important part, how to formulate the team. The team for us is MP, JASC, so medical, paramedical, and JASC for, you see this medical, so developmental pediatrician, eye, ear, and then other members were relevant, neuro, psychiatrist, so psychiatrist for the treatment of the aggression and self-harm, psychologist. So this is the medical. Paramedical, so I'm talking about physiotherapy, occupational therapy, speech and language therapy, cognitive behavioral therapy, dietitian, orthotics, or card service. Okay. So this is now the most important about the treatment of the everyone. So we can share with you, it's quite clear, but sometimes they ask me what is the difference between psychologists and psychiatrists. So I need to know, we mentioned it. So this is non-medical background and has post in psychology. This is providing a type of talk therapy, and they have good techniques to let the parents deal with the difficulties. So it's kind of guidance. But psychiatrist, he's a doctor, medical graduate, and he is specialized in psychiatric problem. He can prescribe drugs and. Okay. So paramedical, so what is the difference between physiotherapy and occupational therapy? So physiotherapy, so this one is dealing with muscle stretching. So muscle stretching. And again, they are not caring with acquisition of skills. So all what is needed is a stretching of the muscle to prevent joint contractures and weakness of the muscles and joints. So this is the physiotherapist. While occupational therapist, so famously wrong, he's concerned about acquisition of fine motor. This is famously wrong, but the correct is occupational therapist is about the acquisition of skills, whether fine or gross. So teaching the child how to use a spoon, teaching the child how to go up and down stairs, so this is gross movement. So how to ride tricycle, this is gross movement. This is occupational therapy about acquisition of skills. Speech and language therapy. So what is the role of a speech and language therapist? So I will just keep it for you next time, just as a homework, prevent speech, the difference between speech and language, because we still have too much for today. So speech is everything spoken, words, letters, anything, and language, anything used for communication rather than the spoken words. So that's why we're calling about sign language for the people who are deaf. We are talking about the sign language, okay? Or we're talking about Brian for the blind people, Brian language. So this is all our speech and language, anything used for communication. That's why if the child, they are assessing the child ability to use words and the child ability to use language for communication. So they do analysis. If he's able to have spoken words and do analysis, where is the problem? So the problem in the phonia, so the production of the voice, or it's the problem in the articulation, or it's a problem in the scanning or the fluency, continuity of the talk. So, or where is the problem? Is he able to use the appropriate words? So that's why they do analysis, and after that, they try to find the appropriate way to help the child to acquire the appropriate skills needed for speech and language. So they are assessing, this is very important, take care, speech and language. First, start by doing analysis and then proceed to make a plan for him to train the child to gain the acquired skills. Cognitive behavioral, we talk about it, dietitian if needed, orthotics, what is orthotics? Okay, so orthotics, I think you are sleeping. This long time we did not take a long class. We are almost about to finish. So now we are talking about orthotics. Those people who are caring about orthotist, the doctor is provision of support like body braces, like ankle support, ankle foot orthosis. So what is their job again? They started to do gait analysis in special gait labs. So they add spatial sensor, put spatial sensors in the joints, and do video tapping of the child moves, follow the sensors on computers, certain computers, and do gait analysis, seeing where is the problem. Is it proximal? Is it distal? What kind of drop or weakness he's having? And then provide the child with appropriate orthosis, including ankle foot orthosis, special shoes, anything like that. So this is the orthotics. You need to know the function of each one very accurately. Okay, we have rule in making the team. So I'm saying this is two basket, and I need to call first the development. I have now, this is the doctors. So I will choose what is relevant only. If you mention anyone not relevant, means game over. So means you will be penalized. So for example, I have a child neurologically normal, and I say, I would like to involve neurologist. They say, why? Psychiatrist, why? So if you are not able to justify your talk, you'll be penalized. Then after I finished choosing from the doctor, I will choose from the paramedical. So this is after that, once you reach to the JUSC, it's a song. You know, this is the morning song. So geneticist for family counseling and family planning, education for the family, education of the child, helping the child with the special education and talking about the education. Then after that, support financially, as you see here, this is the JUSC. Geneticist, the education of the family of the child, and then support. So then after that, financial and psychological, and the last thing, community mediation to join them all. So this means I don't have problem with the second half of the team. So the second half is usually a song, and you say blah, 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 very fast. Okay, but the here we talk about the we missed someone here, which is if you did not, we talk about the.
Sorry, Doctor, what is ORCARD? ORCARD.
That's why
Exactly.
I'm returning back. What is the ORCARD
Okay.
service? So just to see old people. What is the ORCARD service? Where's the old people?
Home visiting nurse.
Excellent. This is home visiting nurse. So usually, especially with a child with chronic disability like quadriplegic CP or something bedridden, it would be very difficult for the family to take the child to the family for things which is minor. So it could be a child, for example, he's having some suction, some issue. So ORCARD is home visiting nurse. So mother usually know about 80% about how to nurse this child. So this ORCARD is just in case of concern or anything, the mother will call the ORCARD, they will go home, do assessment of the child, and if he needs further assessment, she will refer him to the hospital, but if not, so she will keep the child and they will do what is necessary, just suction, correction, doing things, if she can help at home, so keep the child at home. Most of the visits of those children to the hospital are things which is correctable, easy. So that's the meaning, home visiting nurse, ORCARD service. Thank you, Dr. Ibrahim. So now moving to the community here, what are the things we need to know here? So geneticist, education, family, play specialist. Now there are nothing called this is play therapy could be this play therapy, play therapist. So there's difference between, what is the difference between play therapist and the play specialist? So play specialist is usually while you are doing a procedure, inserting cannula. So this is for the destruction of the child. But play therapy is kind of therapy using play. So it's very famous in psychiatry and psychology. So using play for just raising the spirit of the child, learning him about certain skills, reward therapy, things like that. Portage, again, it's a home visiting education, as we mentioned. Cinco, what is Cinco? So Cinco, Special Educational Need Coordinator. So Cinco, Special Educational Need Coordinator. So what is the function or what is the job of Cinco? Let's see, Dr. Ibrahim.
To assess whether the child needs special education support or shall go to the mainstream school, and they'll coordinate regarding that.
Okay, so Cinco is a Special Educational Need Coordinator. She's already in the school. Okay, and this can help if I have a child, let's say in the 2nd grade, and I have a concern regarding his development or his learning or his activity. So what should I need? Any child, even without special educational needs. So this means sometimes they have psychological problems, they have a certain vision problem, any special needs. So any concern regarding any child with delay in the acquisition of skills and the learning, so I need to call the Cinco. So Cinco will arrange for the child to be assisted by a specialist. So if it is in the area of the vision, he will be seen by vision. If it is in the area of speech and language, he will be assisted in the terms of speech and language. If it is general global developmental delay, so she will guide. So that's why it's called coordinator. So Cinco, so she's a teacher with a special training in detection of any child with delay in the area of education and acquisition of skills. So she's a teacher. And she's arranging after that what is needed for this child to be assessed. And if he needs any support, so she will continue to follow that and coordinate that. Okay, so support, financial and psychological. So we mentioned income support by the family, social worker. What else the social worker can work with, can help with? So social worker is helping with money, housing, home modification, transportation. This is all in one scale or in one hand, and in the other hand for safeguarding. So this is the function of social worker. So social worker, if any child has a problem in the transportation, this will be guided with the social worker. Home modification, again, social worker can help on that. So they will arrange for the child to have home assessment and then involve the needed or assign the needed, usually the one who can do home modification, site rails or things like that, could be coordinated between orthotics and, not orthotics, occupational therapist and physiotherapist. Sometimes they can help in this issue. Okay, so psychological, we mentioned, we have educational psychologists, we have psychologists, we have support group, we talk about them, and respite care. So respite care, or this is kind of option, mother with chronic disability. So if she continue to provide care for the child for a long time, she will get in depression. So a child with CP, long time, mother for now 2-3 months, she's every day doing the same job, no off. So definitely she will go into depression. So this is NHS service. Bring the child 3-4 days, okay, and go take a leave, take a rest, go for a picnic, go for a vacation. So you do recreation in order to able to be continued. So we will take care of your child for a few days till you get something relief, respite. So this is called respite care. So if it is for us, I know the especially Egyptian lady, she will use the 3 days in cleaning the home. So removing the carpets, doing vacuuming or doing, using the vacuum for, so she will use the 3 days for the homework. So she would be more depressed. So no other people know, so go out, take a leave this way. So this is the respite care. Health. We talk about the health visitor and orchard service. Health visitor, what is the health visitor and what's her job? So we will see it now. Community pediatrician, this is another thing which is not available in our community. So it's a subspecialty pediatrician, and he's periphery based, or he's just like the GP. So he's not based in hospitals. So he's like GP. That's why it's called community. Community-based, and he's only assigned for people with chronic disability. Any child needs multidisciplinary team. So for me as a pediatrician, I have a child CP presenting with seizure and I'm in the ER. What I'm doing, just to treat with the seizure, either admit or go home, and that's it. But child needs to be assessed social worker. It's not, I'm busy. This is usually, if they leave the issue to me, many people will be missed. Okay, so many people will not get benefit of the available services. So this is the job of community pediatrician. If I am community pediatrician, this is my child. And I'm doing full assessment. I have full list of services. So this child need eye assessment, for example, hearing, he needs social worker, he need one. So I put a list of 7 or 8 people to be, then I will prioritize which one need to be done first. So I will send him to be seen by ENT and return back to me and arrange another meeting with, so this is the job of community pediatrician. So he's orchestrating, you know, the orchestra manager or the leader of the orchestra, this is the man. So he say, you are first, then you next. This is the job of community pediatrician. This is what is called the Red Book. And the Red Book now, this is for every child. So I think we get the Red Book here. If you just write like that, Red Book. Okay. This is, you see, this is the Red Book. Okay. And my personal child health record. You see, this is what is called by the my personal child health record or the Red Book. It came as a communication scenario for the UK. It came one communication scenario, a medical colleague child, he's concerned about what is meant by the Red Book and please explain to him. So this is, you need to know what is about the Red Book. It's very easy. If you just know the components of the Red Book, you will get it very easy. So Red Book is composed of 4 parts and it's concerned about child development here. So you see 4 parts, 4 colors divided into parts, and concerned about vaccination, so development, so developmental milestones. So let's revise it together. So this is the child's Red Book. If you just see the first page, you will know everything about the Red Book. So this is the first page. That's it. You don't have to go through it. It's big, you see, 81 pages, but you need to know only about the components of it. So number 1, personal data. This is the first part. So child's detail, local information, birth details, important health problems, family history. It's about history. Second part about the shots immunization. So things given, things missed. Then screening and routine reviews. Okay, what is that? So list what if your child is able to see, can your baby hear? So list of things to be reviewed by the health visitor. So now we know the job of the health visitor. All of these things are done by the health visitor. Everything in the Red Book is done by the health visitor. Okay, so she do newborn hearing screening program at home. So we have two types of hearing screening. So the number 1, the auditory omissions. So the most simple one, this is done by the health visitor, and if there are concerns, we are doing the ABR after that, evoke the brainstem response in the hospital. So this dislocation of the hip, everything in this, it's related to screening and routine reviews done by the health visitor. The last component of the health, your child first and the growth chart, growth charts. I think if I know only the components, I can describe what is the meaning of this and what is the importance of that. So this is very important, straightforward, to the point, Red Book, and we need to know about it. Yes, we need to know about it, and we need to know what is the uses of it. Yes, because it's a curriculum. I told you it came in the development, it came in the communication. So now at least I know, I've been asked in the exam before, So what is the job of the health visitor? So this is important. Now, developmental screening versus assessment. Screening, this is checks of the whole population of children at set ages by trained professionals, including health visitor, and is a formal process within the child health surveillance and promotion program. So screening means universal for all children. But assessment means that this is for selected children. So developmental assessment, usually we as a pediatrician take care of this point because some people, and some of the mocks, people not taking with me course, and I asked them about this problem. So how can you, for example, assess autism? She say, I will do assessment. So how could you do assessment? She said, I mentioned train observation for 3 days. I say, you as a pediatrician, you will sit for 3 days with this child. It's not your job. So you will do screening, and if the child has delay, you will refer him to Child Developmental Center, and they are the one who do assessment. So this is very important to understand it. So developmental assessment, detailed analysis of particular areas of development following a concern raised by a screening or healthcare professional. It's not universal, it's only for selected people, done by child developmental team in a child developmental center. It includes investigation, therapy, and advice on how to optimize the child progress. So this is all exam questions, referral criteria, indication, and we will talk about it in details. Not now, next class, gross motor. Now, gross motor skills, as you know, the same introduction, the same everything, until we come to the table of the gross motor milestones. Again, it's very simple, and you see it's combination of few things: moves and pulls, pole usement, and then after that, stairs, tricycle, and bicycle, and they are put in books because in the exam, I cannot bring a tricycle for the child or bicycle in the room and stay. So that's why usually I'm asking the mother, so is he able to use bicycle? No. Or is he, how he's going up and down stairs? I will not bring him stairs on the room of the assessment. So usually it's done by history. So that's why we say gross motor is part play, which is the moves and pull, history. So how we are studying this, you will see I put two opposing arrows. So in the, I have the central pillar here highlighted in yellow, and I have, this is, you see, even the shape of the gate here, I put the shape of the gate. So I can, by the flash memory, remember, the first year works forward. Then in the second year, walks backward. Okay, 3 sideway and 2 walking. 4 forward tandem, 5 backward tandem. So this is in the form of walking. Then run, it's walk, run, jump. So special moves, hops, stands, skips, and things like that. Okay. So here we talk about run. You see, this is the walk, this is the tandem walk. So here I can now understand now, if he's younger than 3, it's all about forward walk and backward walk. Older than 3, so forward tandem, backward tandem. I think it's easy now. Okay. Next step will be run. So run stiffly in the from 1 to 2 years. Run smoothly but with wide gait from 2 to 3 years. Okay. Then jump 2 feet together, jump 2 feet together, and jump 2 feet and forward. Most of people does not know that. That's why we will show it you in the videos. Okay, and stand in 1 feet momentarily. Stand in 1 feet. This is the meaning of hops. So hop. Let's see now, and then returning back to the schedule again. If I have a child who can do sidewalk and tiptoe walking, and again he's moving or walking tandemly, so this means he's more in the area of 4 to 5, but he's now still sidewalk and tiptoe walking. Now still in the area jump in place and run. So this means he's younger than 3. So older than 3 or younger than 3, this is what is important. And I have the central pillar, the same 3 as usual. So if the child walks tandemly, not logic to ask him to jump. So walking tandemly, this means he's 5 years. So this means I can, it's anyway, in the area of talk, this is all strategies for assessment if I have the child already. But if I don't have the child, it's easy just to tell the examiner, I will take him run, jump, you see, I will take them one by one. So walk, run, jump, walk, run, jump. I need you to memorize it after me. Walk, run, jump. So ask about, I finished walking, then I move to the run, then I will move to the jump and stick them one by one. Important moves here.
So when we talk about teaching children how
jump,
to jump,
and here, this is the word of
we
jump.
would just want
Jump
to
like a bunny
use the
means,
phrase
see?
jump like a bunny. And we need to be careful not to say hop like a bunny. But we want to jump like a bunny because jumping is pushing off of 2 feet and landing on 2.
So this is the meaning of. So this is the meaning of jump. So jump means
like a bunny.
Pushing in 2 feet and landing on the 2 feet again. So I will show you the difference between a child who is 3 years and a child who is younger than 3.
About teaching children how to jump,
so
we would just want to use the phrase jump like a bunny. And we need to be careful not to say hop like a bunny. Teaching children
there is overlapping.
how to jump, we would just want to use the phrase jump like a bunny.
Overlapping. She's not pushing into, she's like walking or running. This is not jumping.
I mean overlapping between your voice and the video's voice.
So
that's
this
why
I cannot consider. Okay, so this girl, again, I stopped the voice. Okay, I'm sorry. So this girl is able to, here, let me see, is able to, this pink girl is able to jump. Can we call this jumping? Yes or no?
No, I think no. The pink one, no.
Okay. What about? You see, this is a younger girl.
Yeah.
Look at her. Yes, she's pushing into and landing into. Okay, but mostly on place, and then after that she starts to move forward. So this is the meaning of jumping. So jumping, pushing into and landing into in place. So she will be 2 to 3. But if she's pushing into and moving forward like that, she will be 3. So this is the difference now. That's why they say jumping in 2 foot 5 times forward, not in place. Seeing the blue one now, she's moving forward with the jump. You see the blue one. You see, this is now, she's 3 years girl. So I think now it's obvious between the girl who's not able to jump, the girl who's jumping in place, and the girl who's jumping forward. Okay, so this girl, you will see it now in the next video with the next move. She has advanced age. Okay, see now, what is hopping?
Towards their chin as they hop. In conclusion, hopping is pushing off one foot and landing on the same foot. When teaching hopping, we want to tell your children to put their knee towards their chin.
Meaning, hopping is
it's important
pushing in one foot and landing in one foot. So this is the meaning of hopping. So where's our pink girl?
Hopping is pushing off one foot and landing on the same foot. When teaching hopping, we
do hopping. This means she's 4 years. Okay, am I right? So she's able to do hopping, but she's not able to do jumping. Lack of training, she's not exposed. That's it. jump in 2 foot. But if she's able to do the next movement, that's it. This means she's 4 years. Okay, so this is another example for hopping. I think now it's clear what is jumping and what is hopping. And this details, if I understand it, I can, if I examiner, I ask him, if the child is able to jump, he say yes, and keep silent. So if I ask him the next question, so is she jumping in place or jumping forward? So no, she's jumping forward for 5 steps. So this, do you think this type of question I added make a difference? So sure, makes a difference. So the examiner makes sure that I understand it's not a matter of jumping, there are details under the jumping. If I told him if the child is able to hop, he say, what do you mean by hop? If I cannot explain to them, I say pushing in 1 foot and landing in the same foot, this is hopping, and I can show him myself. So you see, this is, now he can understand that I know what I'm doing. Skipping.
Sorry,
Yes.
doctor. So which one is more advanced, hopping or jumping with any forward?
Hopping is 4 years. So we will, if we're returning back again to, we will, after finishing the, I will tell you about the skills first, and then I will return back to the table again. You see,
because the pink one looks younger than the blue one, right? And she can.
Don't bother yourself with the girls. Now we talk about the skill. Hops. Okay. Now you understand what is hops, am I right?
Yeah.
Okay, and this is hops here. So hops, this is advanced skill. So if she can stand in 1 foot for 1 moment only, so she's still 3 momentarily. But hops, she's able to stand in 1 foot and jump on that foot and land on that foot without losing balance. This is more advanced. You get the point? So now we mentioned age of 3 at the age of skill. So sideway to walking, jumping, standing 1 foot momentarily, but advanced skill will be later on. So hops and stands on 1 foot for longer period. Now she's having more balance. You get the point? If she skips and dances, everybody know what is the meaning of dances. So dance. So she's able to turn around, rock and roll and things like that. But the skips not famous. What the meaning of skips? So skips here. It's written here. Skipping is 2 successive hopping in 1 leg, followed by the same of the other. So this child is able to do skipping. This child is no. You see, this one is no. You see this child, 1. So this is skipping, and I will leave the video for you to be more easy. So there is another game. If you remember, when we were young, we had a game like that, and we are divided, and then we have boxes like that, and then we have. This is also could be type of skipping. If they can, where we just have some mark, we put it here, for example, any piece of paper or any piece of wood or anything, and then we just hop in 1 foot and then avoid jumping. You remember this game? I don't know what you call it.
Yes.
So this is, and then you skip over the one with the mark, and then you continue hopping in 1 leg and doing some move. This is also part of skipping. This is a skill of skipping. So now we know about some important moves. We know it already, and using the pole. We have a kick pole. So kick on standing. This is for sure 2 years old, and it's famous, very simple. And the kick on running, this is a measured skill, and even you can anticipate. You see. So this is what is meant by kick on running. So So now after catching, this is again catching. It's now not famous, but not important because we don't have children. Before we need to catch the skill by our eyes, but now this is for our understanding. So but usually just knowing the name will be more than enough. Catching outstretched hands, this is, you see, outstretched hands. You see that the child is, the hands is straight, outstretched, and usually when you throw, the child is afraid of the eye. He's not following the eye movement, the ball movement, sorry. He's afraid of the ball, and he turns the head away from the ball. So these are all things which can help us in understanding. So you will see the child eyes is not following the ball, and even she's afraid of the ball, she's turning the head away from the ball with hands outstretched. You get the point? So this is the age of 3. But at the age of 4, a child has his hands is right angle, is not outstretched. And his eyes keep fixed on the ball. He's not afraid of the ball. You see the difference? And he give a big hugging motion. So this is all, again, you see.
Kind of making a big hugging motion to try to trap the ball.
He's not turning head away, and he's following the ball, and he giving a big hug to the ball. Okay, so this is regarding how they catch. So catch outstretched hand, not fixed, not following the ball movement, and turning the head away. This is younger, this is 3 years old. And when she's throwing the ball, so usually they bring the ball
and that's what you're going to want to do
down.
When they're first starting to catch.
The more the ball is coming from down, so in front of the leg, so the less the power. So they bring, and the less the accuracy, less power, less accuracy. So here see again how she's throwing the ball. She brings the ball from down. So now this is 3 years old. In the age of 4 years, he's throwing, bringing the ball from the front of the, what he's trying to give. He's trying to give more power, you see. He's giving force. So this is in front of the chest. Usually the throwing is from the front of the chest, and he may lean one leg forward trying to give some power to the ball. This is 4 years old. Here in the 5 years, while he's throwing, he got what we call overhead or overarm. So this is the maximum power you can ever give by overhead or over shoulder. So overarm or over shoulder throw or overhead throw. This is age of 5 years, more power, more distance even. And the way they catch, you see now, here they say this is emerging, this is developing, and this is now the most advanced acquired already, and this is accomplished, done. So this means this is the youngest and this is the oldest. See now how they catch. So they catch with only the hands. So they catch with only the hands. And they still using like a goalkeeper taking it to the shoulder. But the more they get advanced, they use the hands only. You see, now this one I can say she's 4.5 to 5. She's using the hands and it's still using the chest for giving it a hug. Still, she's giving the ball a hug. But if it is acquired, he will use the hands only. And child is completely fixing and following with the vision. You see, this child is using hands only. Okay, so this is now what we call, this is developed, 5 to 6, this is child. It's not important because they will not bring your child this age in the exam. But you need to know, the more the advanced, the more we are using less parts, the more the accuracy, the more, you know, he can catch tennis table. So those children can catch a tennis table. And he's also modifying the leg. He can move a step forward or a step backward or a step following, keep following the eye fixed, following the ball. This is all advancement done at the age of 5. And in throwing, you will see now what is meant by overhead. You see the one down here, this one, this is over shoulder. You see, more accurate throw. Over shoulder, overhead, this is at the age of 5. So now this is an exercise.
And bring the ball in and guide it in instead of releasing the triangle.
Don't be this.
In conclusion, please remember it is very difficult for a child to catch in a mature manner.
What do you think?
Please remember it is very difficult for a child to
What do you think? 3, 3, 3, 3. Oh, this means I'm a bad teacher. So again, child arms outstretched or angled.
in and guide it in instead of releasing the triangle. In conclusion, please remember it is.
So child is afraid of the ball. Throwing from down or throwing from front of the chest. See, this is the importance of having exercise. He's not afraid of the ball. He's keep fixing eyes with the ball. And this is not the behavior of 3 years old. Okay, see? His hand's not outstretched and he's throwing in front of the chest. This is all, what is the age now? Yes, I think now it's good. He's 4 years old. I think it's good now. Hope it will. So history, I will ask the mother how he's going using stairs, how he's using tricycle and bicycle, and using my hand. I want you to acquire this skill. You need to show it to the examiner. Now you see he's wiggling, showing him, I need to tell the examiner, you need to acquire this skill. So if it is gross motor, use your fingers. I will use my fingers showing the child is he using 2 steps, 2 feet per step, or he's alternating like that. You get this movement?
1 step at a time like an adult would, or is it sort of 1 foot onto a step and then the second foot?
No, it's 1 step at a time.
Fantastic. Do you walk upstairs 1 step at a time like an adult would, or is it sort of 1 foot onto a step and then the second foot?
No, it's 1 step at a time.
Fantastic.
He say 1 step at a moment. So what do you think, the age?
He walks.
Okay, so now a child with diplegia and a child with hemiplegia, we get this possibility next time. Returning back, now we know about everything, just returning, we almost done about this table. I get an idea about what the child is able to do. He says side and 2 walking, and then after that, I think my child around this age, and I say, is he able to jump in place or jump forward? And I ask about what about standing? So is he able to hop? No, so I need to stretch him. Now he's not able to hop, so we stop here. Okay, so what about catching the ball? How he's catching the ball, how he's throwing the ball. And then now I will ask, is he using alternate feet? Going up using alternate feet, and going down 2 steps per feet, 2 feet per step, 2 feet per step. So this means 3 years old. If going down alternate feet, he's 4 years old. Tricycle and must use the pedal. So I need to say, is he using tricycle? She say yes, and using the pedal. So if any child, you put him in the tricycle, he will sit on the tricycle. So I need to make sure that he's using the pedal and he knows the function. And here, 6 years old, he's able to use bicycle without training wheels. So the training wheels training in the sides. So this is the gross motor. It's very simple, easy forward, nothing at all, very simple to remember. So it's just here. Also, they mentioned in the younger than 1 year, 15. So 15-month crawls stairs, 20 months if adults hold hand. And any child who is using the rail for support, you need to get him 6 months younger. So if he's going upstairs 2 feet per step and he's holding into the rails, so it's the same here, but holding in the rails. So this is 6 months younger. So this is again another important things. Here we are talking about possibilities, child with hemiplegia. child with hemiplegia. So this child, he will not be able to make this jump 2 feet together. He will not be able to make jump 2 feet together. So he will, when we are talking about catching throw hands, so he will not be able to catch it with the 2 hands because one of them is weak. Throw, so he will throw only with 1 hand. And he's going, any child with hemiplegia, very rarely he's doing alternate feet. So you will discover that child with hemiplegia, usually he's showing developmental age younger than the age of 3, usually. Unless he has very good physiotherapy and things like that. But usually in the exam, we are talking a child between age of 2 to 4. This is the most common age in the exam. That's why usually any child with hemiplegia, usually they will fall in this category. So they are younger than 3. So a child with diplegia, it's written here. How can I know that my child is having diplegia?
So when
gross motor. So the gross motor in the diplegia, I will see that my child upper half of the body is functioning very well. So this means he can catch and throw everything at the age, let's say, of 4, but the lower half, so at the age of 2. So there are discrepancy between upper and lower half. That's why if you forget to mention about the ball, how he catch and how he throw, this is the only skill in the gross motor which assists the upper half of the body. Yeah, you get the point? So now we can see how it is important to talk about the ball. So I have ball is assessing what are the parts assessed by the ball only. What do you think? So how he kick and how he catch and throw. So the ball assists 2 areas, upper half and lower half. So he will just kick on standing because he's diplegic, very weak legs, but he catch and throw very well. So this, at this point, I will think of a child with diplegia because of the discrepancy in the gross motor skills between upper and the lower half of the body. To complete my exam, I'd like to other aspects of development, like then after that, HCVB, taking history, checking centiles, revise the patient medical record, checking vitals here has no meaning, and the relevant system, I hear neuro as usual. So this is now talking about recalling the presentation. As we mentioned before, general impression, and then 2 phrases of the gross motor. Chronological age is 6, and developmental age, she did 3 tasks at the age of 3, which is, and task at the age of 4, which is, and then that's why I give her the developmental age of. To complete my exam, I'd like to, so this is how we present case of gross motor. And as usual, this is here in the discussion, we talk about causes of delay, investigation, and management plan, exactly as we did before. Causes of delay here are PIF, same physical, environmental, emotional, and familial, and MP for any child with SIND. So it's referred to Child Developmental Center. This is the management plan. We talk about medical, the same, paramedical, they are the same. And then just as usual, to community pediatrician to join them all. And this is the Child Developmental Center. So this is for child developmental assessment. We completed the gross motor for today. So now this is the development on the new style. And next time we will start to have examples of having history and verbalizing the exam. And it will be 100% similar to the exam situations. Any questions? So anyone asking any question in the exam, he starts to say, I'm sorry. So I really know that you are so polite. That's why you're saying, I'm sorry. But you know, when you're asking this, give me, I would be happy with asking. This means you are alert and you are concentrating with me. So questions is not bothering me at all. I may defer it or keep it at the end of the discussion. Sometimes I say keep it because I have heavy topic or things yet not covered. But really, I admire and respect everyone asking in the middle, and he's keeping interacting with me during the class. So this is an important point. Thank you for today. Hope to see you next time, and study well. And let's see next time we'll apply together. Assalamu alaikum.